Call the roll, please, Ms. Clerk.
Councilmember Jordan?
Here.
Councilmember Alejandro Gutierrez?
Here.
Councilmember Friedman?
Here.
Councilmember Harmon?
Here.
Councilmember Oscar Gutierrez?
Present.
Mayor Pro Tem Sneddon?
Here.
And Mayor Murillo.
Here. Thank you very much. Mr. Casey, are there changes to the agenda?
Many, Madam Mayor.
Okay. Go ahead.
If you don't mind, we would like to continue item 19, the presentation of the draft sea level rise adaptation plan. We'll bring that back at a more appropriate time, and staff will work on initiating that outreach when it is appropriate with the community. And then my recommendation would be that for the order of today, we have some professionals here who are extremely busy, and so I would like us to start with item 18, the coronavirus update, and then after that, return to the consent calendar and public comment for items not on the agenda. I think we should focus on the coronavirus update first.
Good advice. So general public comment will be at the end of the meeting. Consent calendar will take later as well. Let me see. Julia Mayer, were you here for the coronavirus discussion or another topic?
No, for the coronavirus.
Okay. Gerard Pepe, are you general public comment?
Yeah.
And Michael, general?
Yes, and are we going to be revisiting item 18?
You need to come to the microphone, sir. Yeah, we're starting with number 18.
Okay, so I need to go into that.
Okay, then we'll talk to you about that. David Potter, Megan Coonan. Thank you, and Ms. Villanueva. Okay. So we'll go ahead and start. Mr. Casey, the item then we're switching to, Ms. Clerk, is number 18. Would you go ahead and read that for us?
Yes, item 18, coronavirus update.
Mr. Casey, go ahead.
Thank you, Madam Mayor and council members. So we wanted to have today's meeting be focused solely on the coronavirus update. Things are moving extremely quickly. There's a lot of information to try to share. It's changing by the hour. And so we have a presentation for you to bring us up to date as best we can. If we can go to the start of the slide, the overview of the presentation is we'd like to start with Dr. David Fisk from Cottage Hospital. He's here to provide us an update. We greatly appreciate him taking the time to be here. And my promise to him is that we would get him in and out of here in 30 minutes since he is extremely busy. So I would like us to do that. And then we'll have an update from Bruce Stensile, who's the president and CEO of the Economic Development Collaborative, to talk about some local business impacts. And then we'll review an emergency proclamation declaring a local emergency. And so we'll talk about that. I have also signed that starting yesterday, but we need your follow-up today. And so we'll talk about what is included in that and actions we can take. And then once you're done with that discussion and action, I'll just follow up with what the city is doing as an organization to give clear understanding to how services are going to be moving forward, but in a more social distancing environment and the steps we're taking to address that. So those are the issues I would like to cover. And if it's okay, we'd like to go ahead and get started. And I'll turn it over to Fire Chief Nickel.
Thank you, Chief.
Good afternoon, Madam Mayor, council members, Eric Nickel, Fire Chief. We also have several city staff members here that are available to answer questions once Dr. Fisk has completed his presentation. And again, back to the important point that staff is very busy. Your city staff is out there taking care of business right now. So we've limited some of the city staff that are going to be here today. We have some good news stories that we want to share with you, some things that, necessity is the mother of invention, and there's some really great things going on here. And without further ado, I want to go ahead and turn it over to Dr. Fisk. Doctor.
Thank you.
Good afternoon. Thank you, Madam Mayor and council members and Fire Chief Nickel. It was a week ago that we met here, and we had a nice discussion at that time addressing many of the pressing issues of the day, but what a difference a week has made. I think it is safe to say that this situation is much more tangible and real and less theoretical today than it was a week ago. I would emphasize that today I am representing Cottage Health. I am also employed by Sansom Clinic. I do not, work for the County Public Health Department, but I can try to update you on things I have been involved with where there's been interface with public health. So first of all, just by way of summarizing the big picture view, in the last week, not only do we now have declaration of a national emergency, we have increasing number of cases nationally, we have had additional deaths nationally, and obvious additional social measures designed to try to combat the spread of the virus in the United States. Locally, we now have confirmed disease of a case in Santa Barbara County, in a felt to be a disease of community origin, meaning not travel related. And the health institutions throughout the county have been working furiously to try to address preparations for managing patients with this illness, but also to actually dramatically expand the number of tests that have been done on patients who have symptoms that could suggest this virus, but also to continue to work to increase further the number of tests available in our region. And we'll come back to that in a bit. To give you a sense of the picture, I think, on the healthcare front, as I see it, there has continued to be what I think truly exemplary collaboration between institutions throughout the county. In the last week, I've been on several joint calls between Cottage Health, Santa Barbara County Public Health Department, Sansom Clinic, the neighborhood clinics, Marion Medical Center, Lompoc Valley Medical Center, and others who I may be omitting from this calls. And those calls have been aimed at achieving a common understanding of what we're dealing with in the county, but also to try to develop some standardized approaches and procedures for addressing patients with potential COVID-19 or so-called SARS coronavirus 2. The emphasis of those calls really focused on the issues of testing and on the concerns of testing in our region. We have a situation where this virus creates respiratory symptoms that we discussed last week, and I won't get into again today, but those symptoms have overlap with numerous other common respiratory infections like influenza, a virus called RSV, and many other illnesses. So that means there are a lot of patients in our county and in our city who may have symptoms that could be COVID-19, yet the vast majority of those are not. They're caused by our typical everyday infections that we deal with. So the institutions have tried to design a system where we can screen individuals with these symptoms in the highest number possible, but also targeting screening to those who either have the highest risk of doing poorly when they're infected with COVID-19, or those who the finding of a positive test result for COVID-19 would have the greatest impact on public health. So, for example, screening has been targeted at those being admitted to hospitals because it impacts the management of a patient who's in the hospital significantly, but also has importance for infection control practices in hospitals. Other screening has been targeted at individuals who work in healthcare, so they don't inadvertently expose other patients and also don't then expose other healthcare staff that would reduce the resources available for healthcare workers to combat this epidemic. Those living in group living settings, such as long-term care centers, to those that are homeless, who may be living in shelters, and to those who have high risk because of features of their health or their own person that impact their ability to fight this virus. That would include things such as age over 65, people with pre-existing lung disease, or other illnesses such as heart disease, diabetes, or kidney failure, and the like. So the upshot of the calls that I mentioned was we developed a common criteria, a minimum criteria for becoming eligible to even be tested in Santa Barbara County for COVID-19. And we emphasized that those criteria that we came up with were a set of minimal criteria, and also that these criteria were designed to be temporary and change as the epidemic changes, but also change as our supply of testing changes. One of the major challenges we're facing is the extremely limited access to testing. That was an issue last week, and it's an even bigger issue this week. And so based on that, the organizations felt it was important to have a minimum set of standardized criteria. That jointly agreed upon criteria was then sent out through the Santa Barbara County Public Health Department to all of its usual channels and healthcare providers in the county. And so we hope that as testing capacity improves, that those criteria could be relaxed. But for now, that's what was agreed upon and recommended for healthcare settings throughout the county to follow in order to maximize the utility and yield of sending off a COVID-19 test. The other, we are seeing at Cottage Health, we presently have about 10 individuals in Cottage Hospital who have fallen into this umbrella where they are warranting a test for COVID-19. And that number changes by the hour. It goes up, it goes down, but that's roughly where it is today. And but we do not have thus far any positive tests within Cottage Health, fortunately. And we do expect that we will get them, and our institution is ready to manage these patients, as we discussed last week, and our preparations have only intensified. And if I may, let me include a few of the new measures that are going on within Cottage Health. We have continued to improve our communication and streamline our communication with the county public health department, particularly through our emergency department, to maximize turnaround time and reduce turnaround time, I should say, for these tests, and to optimize the ordering of tests. Cottage Health has continued to reinforce its supply chain for not only masks, but other items needed for the care of patients with COVID-19 or patients who may be suspected of having COVID-19, such as gowns, gloves. We just got 3,000 additional face shields in, I believe, in the last 24 hours, for example, for our inventory. We are seeing a dramatic uptick in our usage of these supplies as we have more patients with suspected COVID-19 presenting for our care. And so we're monitoring that literally on a daily basis. We're getting numbers of masks, numbers of gloves, numbers of N95s. We have obtained additional of these so-called PAPRs, the powered air purifying respirators, the battery charged respirators for our use. And we are in the process of ordering more ventilators, and those in fact have been ordered, and we have received some additional ventilators from the Santa Barbara County cache of emergency supplies. Those ventilators have to go through a process of refurbishing, and so they are going through that now. But we are working towards having more ventilators available should we need them for people who get severe symptoms of COVID and cannot support their own breathing. That's a very minimal aspect of what we're doing on a daily basis. You may have seen Cottage did set up a tent yesterday outside the emergency department at the downtown campus, and that tent is intended to test patients for COVID if they are felt by Cottage staff to have symptoms representing COVID. That is not a tent that will offer drive-through testing or testing without pre-screening by the Cottage Emergency Department staff. Part of the aim of that tent is to, if we get a large influx of patients with COVID, to protect other people coming to the ER for other purposes, so that they won't be potentially exposed to patients with COVID, and also to enhance the, in a sense, the throughput through the emergency department, so the ER does not get backlogged and can do its functions needed to care for other illnesses in a as timely a fashion as possible during this epidemic. So I want to emphasize again, though, that tent is not going to serve as a community testing point, and Cottage is not encouraging people to just show up there requesting a test, because they will not be receiving a test unless it's felt, after they get a thorough evaluation through emergency staff, that they may have symptoms to suggest COVID. Cottage has also taken steps to enhance its virtual care and telemedicine platforms, so that screening for potential COVID symptoms, patients who are concerned they might have COVID, can access the Cottage telemedicine portals and virtual health portals. That is part of our effort to provide this service, but also to avoid backlog in other ambulatory care and outpatient care settings throughout our city and throughout our county. What else? I can't emphasize enough how rapid of pace this effort is progressing at Cottage and with our partner healthcare institutions within the county. People are working literally day and night, 24/7 on this issue, and amazing strides have been made in a short time to ready our community for a potential increase in cases. I would say, though, still to me very reassuring, is that our overall hospital census is at normal levels. We are not seeing the hospital bursting at the seams, and we have not seen an overall increase in people with serious respiratory illness in the last week. And I also do find it very reassuring on a national scale that the vast majority of deaths from this infection in the United States are still associated with one outbreak in Washington State, and that we're not seeing widespread fatalities around the country from this. Nonetheless, we do remain very concerned and see need to prepare to the utmost degree for what situation that could become worse in our community. To me, I want to get back to testing a little bit more and focus on that. I know that is a large source of anxiety for individuals throughout our community. B, a source of concern for when people who might benefit from this test, who might truly benefit from it, may not have access to it. And C, also, of course, a concern for healthcare providers and healthcare systems who are trying to care for these patients and get the optimal information we would like to have in order to, provide the best care possible. So the way testing has evolved in Santa Barbara over the last week is we have testing available through Santa Barbara County Public Health Department, and a second avenue of testing available through private laboratories, mostly national labs such as LabCorp and Quest. And the testing capacity through the public health infrastructure in Santa Barbara County remains very limited, and there are efforts afoot to try to expand that. But at the time, it is certainly not meeting anywhere close to the demands for testing, even for those admitted to Cottage Health who would benefit from testing. The turnaround time that we have generally seen on a test going through the public health channels has been about a day from when the test is obtained to when the test is resulted. We are starting to see and anticipate an increase in that turnaround time, maybe to about 2 days. When a test is sent through private laboratory channels, i.e. a test that may not be ordered at Cottage, that might be ordered by a physician in his or her office, or a test from someone who might have been seen in the Cottage Emergency Department but who does not require hospital admission. That person would then be discharged home. That test would go through a private laboratory channel. The turnaround time on those tests has been on average about 4 days. And so that means there are then the need for people who are out in the community to remain in home isolation while those test results are pending. And that has obvious impact. The longer it takes to get a test back, the more disruption that has to someone's daily living and the more potential for spread of this virus if we truly don't know if someone is infected for a longer time. There have been shortages on the public health front in the chemicals needed to run these tests, and that is impacting the public health capacity to run these tests, and that's a real concern. Those are not, from what I hear, expected to be long-term shortages, just a day here or a day there, and then they're getting resupplied. So the and I can speak on a more broad basis now, beyond just Cottage. The community supply of N95 masks in our community is much better than most communities, but those are considered valuable commodities right now, and healthcare institutions are taking steps to protect those masks so they do not go missing from the healthcare institutions, which has been something observed. And the Cottage has, for the moment, a good supply of these and has received some supplies from the counties. We do need to remain vigilant about the use and consumption and supply of these masks, but at the moment we are in a relatively good shape compared to many other communities. We talked last week about the issues of potential disruptions in supplies for other procedures at Cottage, such as heart valves that would be implanted at surgery or artificial hip joints, things like that. I think for the most part, I think we are seeing those type of supplies still adequate for what we do, but we are also monitoring that supply chain very carefully. There are 2 medications that are in undersupply due to shortages in the manufacturing chain from these products in China and elsewhere. But I don't think that those are going to be long-term shortages. So there, as you can see, this is a very complex situation with a lot of issues and moving parts, and I've only addressed a small number of them, but happy to take questions and answer things as best I can for you guys. Thank you.
Before we go to questions, I see out in the audience some people are a little too close to each other. I think we're spread out vertically, but if you could space yourselves out, please. Thank you. I'm going to start with a question. So, sir, the governor has said that directing bars to close. I know you're not representing County Public Health today, but could you just tell us medically why it's a bad idea, how it would spread the virus by bars being active?
Yes, thank you, Madam Mayor. The governor's proclamation on closing bars, I think, is based upon the knowledge that this virus spreads when people are in close contact for a prolonged period of time, and that this virus can be transmitted from surfaces, as it can live on surfaces for hours or days, depending upon the surface. And when you have a bar where people tend to be in close contact, well under 6 feet, certainly the risk of transmission of this virus increases. And people, many times when they go to bars, tend to spend more than a few minutes there and hours there. So when you have a situation where people are in close contact, it promotes the transfer of this virus by what are called droplets. So those are secretions from one person that can travel over short distances to infect another person, or can end up on a surface that a second person then touches and contaminates and exposes themselves by then touching their mouth, their nose, or their eyes. So that is the rationale from a medical perspective behind that recommendation.
And what would the benefit be? Some counties in the Bay Area have ordered shelter in place, meaning people stay home. What's the benefit of that?
The benefit of shelter in place is simply it limits social interaction, and it limits people going out of their home to other settings where this virus might be living on a surface or where they might come in direct contact with another person with that virus. The situation, particularly in Santa Clara County, is dramatically different from ours. The situation there is there's much more community spread of that virus than we have seen here. And so at the present, the community risk of acquiring the virus there is much higher than in Santa Barbara County. You may have heard the term flattening the curve, which
Yes,
has
sir.
been
Tell us about
popular
that.
press lately. And that's what they are trying to achieve in the Bay Area, simply because no one, until people have recently recovered from this infection, none of us have immunity to this virus. And they are therefore trying to slow down the rate at which people are exposed to this virus so that fewer people will be getting sick at any one time, and therefore the healthcare infrastructure has greater capacity to care for those that do get sick than if everyone got sick at one time.
Well, I think one of the questions we'll be pursuing with county public health here in Santa Barbara County is what's that threshold where we would take a measure of telling everybody just stay home?
Yeah, I can't speak for
I know.
public health on that, but I would offer that I do think our situation here thus far is very, very different from the Bay Area.
Okay. Mr. Friedman, go ahead.
Thank you, Doctor. Just a couple of questions. Are those who are asymptomatic but still positive, are they considered infectious? And I know that there's been talk about individuals who have it who are asymptomatic. Can you speak to that?
Yes, thank you, Councilmember. The question, or I would say the response I have to that is that individuals who are not having symptoms of COVID-19 disease, but who may be in the period where they actually are infected but don't know it yet, so meaning before their symptoms arise, during that window, it has been shown there is some capacity for them to transmit that virus. That period, the so-called window period, still is dramatically less risk of transmission of that virus than compared to when someone is actually symptomatic. And that is really felt to be the case for this virus, but essentially any other virus that we know of. It's not a unique finding for this virus that you're much more communicable when you have symptoms than when you're not.
Thank you for that information. And in terms of some workers, such as grocery stores and others that are out there in high contact with a lot of individuals, do gloves or masks help reduce the risk for the workers?
The gloves, as commonly used by the general public, do not help reduce the risk of transmission of this, because the virus can get on your glove and then you can touch your face with your glove. And so, so in that situation, it's not felt that it would reduce transmission unless, for example, you change the gloves after every time you touched a surface or another person, which is obviously not practical. The answer to the question about masks in the general public is it is not advised by CDC that the general public wear masks, because the evidence for reduction of transmission of this virus when general public is masked is lacking. There's a few more nuances to that answer, though, because if everyone, for example, wore an N95 mask, there might be a small, and I emphasize small, reduction in transmission risk because that mask would prevent the small percentage of transmission of this virus that is felt to come from the particles of it that stay suspended in the air, the so-called aerosols. But that is felt to be a relatively minimal or minor fraction of the percentage of cases that actually get transmitted, whereas the majority of them come from these larger droplets, and so the droplets can get into our bodies in many other ways other than just breathing them in. So it is, at this time, it is not recommended that the general public mask, and we have not seen evidence of that reducing transmission generally of other viruses as well.
My last question is, you mentioned earlier about telemedicine, and is there a phone number to call or a website for people to call? Should they go to Cottage website, or where can they get information on that in particular?
Yes, they can go to the Cottage Health website, and there will be information on linking them to the telemedicine platforms there. I don't have a direct phone number for it, but I know there are linkages from the General Cottage website to that. I would also add that in healthcare, it has been advised now that we try to limit so-called non-urgent visits to the doctor right now, and so SANSOM, where I work, is taking measures to reduce the patient encounters at SANSOM that are not of the highest urgency, the more routine visits. And SANSOM is actually also launched, in the process of launching options for telemedicine encounters with providers as well for these non-urgent visits. So you'll be hearing more about that in the coming days as well.
Thank you for your time. I appreciate you answering and being here.
Councilmember Oscar Gutierrez.
Thank you, Madam Mayor. Thank you, Doctor. Can you just reiterate how long the virus can live on certain surfaces?
Thank you for that question, Councilmember Gutierrez. I think the evidence for that is changing literally day by day, and there is more information on that even came out today. The answer to your question is it depends dramatically upon what type of surface you're discussing. From some surfaces, such as copper, it might be 4 hours. For other surfaces, such as cardboard, it can be a day or longer. And it also depends heavily upon humidity in the environment around the surface. The virus seems to live longer in areas of high humidity than low humidity. And there are certainly some descriptions now of the virus on some surfaces being detected after several days on those surfaces. But for most situations and settings, and I think the majority of surfaces, the number is on the matter of hours rather than days.
So, for example, facial hair or hair in general?
Have no idea.
No idea. Would you recommend facial hair to be shaved off?
No, I would not, because I don't think we have hard evidence that impacts transmission of this virus, really, or other viruses.
Okay. And would you recommend social gatherings like this to continue as what's going on in City Hall right now?
Well, the guidance from from the executive branch has been to limit social gatherings to those under 10 people. And I know California is advised to restrict gatherings under 50 people. I think part of it depends upon how you define a social gathering. And I think gatherings of critical functions like government, to me, are very different from gatherings at private residences or true social settings. So I think my answer to that depends upon how essential is that social gathering for the functioning of our community. And so I think in a situation such as City Council here, that it should be continued, but that social distancing should be enforced in this chamber and in other settings where Santa Barbara City is functioning in its role of government.
Thank you.
Ms. Snedden?
Thank you, Madam Mayor. So appreciate you being here and expressing that in a week's time so much has changed. And I have just 3 sort of quick questions. One, where's the best place to get this type of information? I realize that I think you're probably spread pretty thin coming and reporting to each board or council, and where's the best place to get information on, say, the evolution of the virus or how long it's living on surfaces or the changes that happen rapidly?
I think the answer is there are multiple settings that I would refer one to Councilmember Snedden for information, and I would include the Centers for Disease Control website for public information on this, California Department of Public Health website, the Santa Barbara County Department of Public Health portal that was launched last week, which has information relevant to our county, information from the World Health Organization as well has been quite useful, but there's literally is changing extremely quickly where this information is, and I think a good thing is that we're seeing more and more sources come out with good and reliable information on this. But we do have to realize, no matter what source we're looking at, information that is current one day could be completely different the next.
Thank you. And then the next 3 are related. I think since you were here last week, schools have closed and everything has gone to home instruction. And I've gotten a lot of questions about, well, can play dates happen between younger children if they just have one friend that they're going back and forth between, or dating, can that continue to happen? Or a lot of questions in the community about if it's a small group or is that serial transmission. So that just in-home play dates, I guess as they're called. But then also when you mentioned bars, how does that apply to dine-in restaurants or to retail situations touching of individual shopping items, and if you could comment on that also.
Thank you. Yes, and I appreciate the questions very much, and they are highly relevant to all of us, not only in our personal lives, but as we also think about trying to maintain a workforce that can stay healthy to do the things that need to be done in our community. In terms of play dates, I feel that the guidance of keeping those gatherings to limited size, i.e. less than 10 people, is advisable in to be consistent with the federal guidance we have received. I also am appreciative that play dates for young children involve kids that are generally low risk for doing poorly if they got infected with COVID-19. At the same time, we do not yet really know if kids can be carriers of this virus and transmit it to adults, even though the kids never get symptoms or have very minimal symptoms from this. That's still an unknown. So to me, I think the ultimate answer to that is it is a very personal decision whether a parent feels comfortable with their child potentially being exposed, but perhaps even more so if their child were exposed, who else that child might then infect. And so I think parents need to think carefully about their own health. Do they have weakened immune systems? Do they have pre-existing lung disease or other illnesses or medical treatments that might make them higher risk for doing poorly if they got infected with this virus? And they need to factor that into their decisions about play dates. Same goes for dating. In terms of, and the second part of your question was about restaurants.
Restaurants and retail.
And retail, thank you. My feeling on restaurants is that I would suggest, in line with what we've seen from county public health and others, that social distancing is critical in a restaurant establishment. And it had been recommended that if the restaurant can reduce its capacity to serve by 50% and space people out, I think that is a very reasonable recommendation at this time. But that does need to be reevaluated on a daily basis as we see the evolution of this virus.
I have a cough drop.
I'm fine, thank
Okay.
you. Glass of water helped. Talking too much.
Ms. Harmon, go ahead.
Thank you, Madam Mayor. Thank you so much, Dr. Fisk. And I will be brief because you're 15 minutes past your deadline to leave. So you mentioned that our community spread situation here in Santa Barbara is much, much different than in Santa Clara, for example. Do you anticipate that our community will reach those levels? And from a medical perspective, would it be useful for us to take some of the measures that have been responsively or sort of in response to the spread of that put in place for us to do it proactively as an effort to mitigate the spread? And would that have an impact?
Thank you so much for that very important question, Councilmember. I feel that being proactive should be first and foremost on our minds, because that's what it will take to flatten the curve here. But that what is proactive in one community may not apply at the same time or may never apply to another community. And that when we are being proactive, we need to keep those decisions based as much as we can upon the evidence we have for what this virus does, what it can do, and what it's doing in our community, and also factoring in how our community differs from others. So to be more specific about proactive measures, do I feel that in Santa Barbara City we should go to a shelter-in-place mode now? I do not. We have, one confirmed case in the county. We have no deaths in the county, and as far as I'm aware, we have no patients who've been hospitalized in our county with this. So I think we do need to be proactive about protecting our most vulnerable, and that would be people with the types of chronic medical illnesses that we have all discussed last week and some this week. Those of older age, those with weakened immune systems, should limit their activities and limit their social interactions and limit their time in public settings. The closure of schools obviously was a decision not undertaken lightly, but hopefully will slow the spread of this illness here. While I certainly don't have a crystal ball, I think our community is fortunate in so many ways that will likely make us less likely to have the type of problem we're seeing in northern Italy, for example. But that needs to be assessed on a continual basis, and our actions and responses to that need to be modified. And we talked last week about the need to be adaptive and fluid in our responses, and I think that needs to be the theme as we go forward on this. A decision that's one day appropriate may not be the next, but that's where the communication that we are seeing amongst really all of the health authorities in this region needs to continue.
Thank you, Doctor.
Okay, any other questions from the council? We'll Thank you, Dr. Fisk. And there's a way for us to get questions to you or County Public Health in the future, so we'll go ahead and do that. We do have another presenter today, Bruce Stensley with the Economic Development Collaborative. So thank you.
Thank you much, Madam Mayor, very much, and
All
council
right.
members.
We know you have to get back to work, so thanks. Oh, one more question, Mr. Gutierrez.
Thank you, Madam Mayor. I apologize. Are the results of the 100 private tests confidential like they were in Seattle when they were blocked from releasing the information, or were they all just negative?
The results of those tests are confidential, as they are protected health information. I also am not in a position to, be even necessarily aware of all the test results throughout our county, because I do not serve in a public health, leadership capacity for the county. But I would reemphasize that I am, not aware of any of those private tests that have been sent having a positive result at this time.
I assume they would notify everyone as soon as possible.
Yes, I think public health is very attuned to notifying the public when there is a positive result, and I expect that will continue as more positive results come in. So that's why I'd say the information on who is positive is confidential. Public health is definitely making the public aware when positive results do come in, so that our county and city can respond and take measures as needed.
And can you just reiterate, do you have an understanding as to when we would get more tests?
We are getting test results back every day. When results are run through the public health labs, which here in Santa Barbara, those labs have been Ventura and San Luis Obispo. When those results come in, it usually comes in the late afternoon each day. We get a batch of them. When test results come in from the private labs, those can come in 24/7 and certainly don't all come to me.
Sorry, I meant to say the test kits.
Test kit.
The test kits. I think that would be a question more appropriate for the Public Health Department to answer.
And how long do the tests usually take to come back with a result?
From the time a sample is obtained from a patient, it has generally been 1 day when a test is run through the public health labs, but we anticipate that may increase to 2 days based on information I'm hearing from my lab colleagues. When a test is obtained from a patient and sent to a private lab, the average turnaround time on that has been 4 days. We hope that turnaround time will decrease significantly as the national labs ramp up their capacity to do more tests. But that's so far. We did an audit within Cottage and looked at our private lab test results, and as of last night, the average turnaround time was 4 days.
Okay, so the amount of test kits we have, you personally are unaware of, or the county health department is unaware of?
I am personally unaware of, because those test kits are in the possession of not only Cottage, but they're in the possession of Pacific Diagnostic Labs and their locations outside of Cottage. Those test kits are in the possession of Marion Healthcare in Santa Maria, and I have no affiliation with them. Similarly for Lompoc Valley Medical Center, et cetera. Also, individual community physician offices can order tests if they choose to and send it to a lab that they have a contract with. And so I don't know any numbers of those test availability through the individual physician practices throughout the city and county.
But County Public Health, in their press conference yesterday said that there's more coming in. That they want more, but they don't have enough right now, but there's more coming in.
Okay, so they're being conservative about it for obvious reasons. Gotcha.
That's one way to
I
say
don't,
it.
I don't think right now, if I just may add, the holdup in obtaining testing, I don't think is through the number of kits available. It's through, once a kit and sample is obtained, the ability to process that kit in a given laboratory. That's where the holdup is. And that is a function of limitations of equipment in the laboratories and staff who can, train staff who can run those tests.
Thank you for that. I appreciate that.
Okay, we thank you, and
Madam Mayor,
oh,
can
go
I just
ahead,
add
Chief.
two points of information to clarify Dr. Fisk's presentation here. The city did ask County Public Health to attend today. Obviously, their workload has increased, and they were too busy to attend here today, but we are in daily contact with them through the fire department and asking a lot of these same questions that are coming up that come through us. But clearly their workload has emerged and become very emergent. And so they were unable to attend today. And then the second thing, there was a question asked about a call center. And the County Public Health does have a call center set up, and it's available every day. And that phone number, it's available every day from 8 a.m. to 5 p.m. to ask a lot of these questions. It's area code 833-688-5551. And that is the County Public Health Call Center.
Can you repeat that one time a little more slowly for those
Yes,
who are watching at home?
slowly. Area code 833-688-5551. Thank you.
thank you, Chief.
Thank you, everyone.
Okay, very good, thanks. So to set the stage for Mr. Stensley, we'll be switching gears to how we're trying to help small businesses get through this trying time. So Assistant City Administrator Nina Johnson and I had a meeting with a couple of small business people yesterday. Mr. Stensley, one of your staffers, Claire Brelio, gave us some assistance, and you're here today. Thank you very much. We have some business owners in the audience, so I know, and we're all ready to hear what you have to say, and thank you so much for being here.
Thank you, Madam Mayor, members of the council staff. Bruce Stensley, I'm the president of the Economic Development Collaborative. We're based in Ventura County, but we run the Ventura and Santa Barbara County Small Business Development Center, provide services down into Los Angeles as well. Just want to say a couple of things. We work very much in collaboration and coordination with other organizations with whom I'm sure you're very familiar, Women's Economic Ventures here in Santa Barbara, SCORE with several of the chambers of commerce, the business incubators, co-working spaces, and others. In our case, very briefly, can you flip to the next slide? And we'll see one more. There you go. Our Small Business Development Center, the way we operate is we have about 30 professional business advisors available at no cost, professional, confidential, to engage with business on any number of issues that may range from strategic planning and business plan management to access to capital to social media to operational efficiency to international trade operations, you name it. And we're here and available to make sure that we get those services connected to businesses. We served almost 900 firms last year, and given the circumstances this year, we anticipate that to go up. A couple of things. We have Eric Zackerson here. Wave hello, Eric. Eric is one of our expert consultants, an educator and coordinator of a variety of things, works very closely with the Santa Barbara Chamber to make sure that we have that coordination and work in that manner. Go ahead, the second slide. So what is the current scenario? What we know is that this downturn, let's call it, uncertain to become a recession at some point, is about the service sector first, right? It's not an impact to our financial system as we've had in the past, and it's not the underlying nature of finance and the economy. Rather, it's this external shock, and it's about the service sector. So with that, a little bit of data I just want to throw up there, and I'll come back to these in a moment. The brunt of this is going to be, as you all know, the hospitality and service sector, accommodation and food services. Of course, Kathy Janica Dykes, who visits Santa Barbara leadership, could tell you more about that economy, but let me just leave you with a couple of data points. In the city of Santa Barbara, food and accommodation, that is Restaurants, bars, and hotels are about 17% of your jobs. That's compared to about 13% in the county as a whole and about 10% in the state as a whole. So you're actually approaching an almost doubling of the concentration of jobs in the sector that is most severely impacted by this. So 17% of your jobs. In raw numbers in the city, that's around 7,000 jobs. Not necessarily residents, there may be people living elsewhere and coming in, but jobs in the city that the businesses are employing, around 7,000. Not sure the exact number, probably 5,000 of those are in food service and restaurant, bars and restaurants, and the other 2,000 in hotels. And to give you an idea of the scale of the city of Santa Barbara relative to the county as a whole, you have some 44% of those hospitality jobs that the county has as a whole. So you are really, not to be overly negative, but to be clear, sort of ground zero for the impact of this kind of economic impact. And I'm not even yet indicating the larger retail and service sector. That's just the core food and accommodation. What we're seeing, of course, and through our consulting networks, is the first one sort of a no-brainer, this declining sales, managing changes in margin, supply chain issues. We work with a lot of manufacturers here and throughout the region. Supply chain, a massive impact to the whole global economy. So it's not only the service sector, that's the most immediate in terms of jobs. And you see this across the board. So put another way, this is a hugely significant impact to the city. And we also recognize that it's not, that it's also, the nonprofit sector and the health sector. And it was fantastic to hear the words here this afternoon, but we also appreciate that those folks in providing services as businesses in the health sector are hugely constrained. So that's a little bit about the downside. Let's talk a little bit about what we can do, and I can get out of your way and be happy to answer any questions. So what I would like to do is, one of the things that we do is assemble a business resource recovery guide, and I'd be happy to throw these here. There are about 15 of them. We can get them around. It's on our website at edcollaborative.com. You hit our homepage. We actually coordinate very directly with the governor's office. We're almost a lead for the governor's office in assembling this information, not just for our region, but statewide, to make sure that we're staying on top of local, state, and federal resources to make sure that we're responsive. To access the services I mentioned a moment ago, we recommend two things. Number one, you can hit our website, edcollaborative.com, any business. There's an online scheduler, so we don't have to go back and forth trying to schedule in phone conversations, but a business can go there, get an appointment with us within a couple of days. We can nail that down and move ahead. And I really want to plug as well, Women's Economic Ventures has huge capacity to do this as well. We're very complementary in making sure that we've got comprehensive resources for the region. You go to their website and get much of the same information and access to services. So looking at this guide, I'm just going to go through very quickly a handful of issues that would either call issues or recommendations. And the first has to do with insurance. We get this question a lot. Whether you've just got property insurance, liability insurance, and ideally you have business interruption insurance, more than likely you're going to find if you're holding one of those policies that there may be an exception for a pandemic and this kind of thing. That said, we still recommend that every business review that insurance, contact their insurance broker, inquire about their coverage, and actually even make a claim if they've got enough impact, because you want to get into that process. Even if you think that claim is going to be denied, we don't know what the federal government, the state government, or the insurance companies may do in terms of next steps in identifying what kind of business support can be provided. Also, a business providing insurance or accessing or at least applying for insurance might be important for accessing other U.S. Small Business Administration resources. If you haven't exhausted your opportunities with insurance, you may not be eligible for other low-cost capital, et cetera. So insurance is critical. The second thing that we really encourage all small businesses and all businesses to do as they're coming into this kind of a crisis, and ideally you're doing this all the time, but really managing on a monthly basis what your revenue and expense looks like. The ability to secure low-cost capital and loans from the U.S. Small Business Administration, from banks and others, or alternative lenders like us, which I'll mention in a moment, is largely going to be on the degree to which you can document that you've had a period over period loss, that you had such and such income in the month of February, in the month of March it tanked, or in the month of March 2019, you had this, in the month of March 2020, a different scenario. Being able to document that. Without doing that, you can't make a compelling case to get the assistance your business may need. Moving on, for employers and employees, several things. Before businesses make rash decisions, and I understand I don't want to say rash actually, but quick decisions in laying off workers, the California Employment Development Department has a number of programs, one called Work Sharing. There's a link to that program on the material on our business resource guide, where there are opportunities and ways that businesses can cut the hours of their employees and still access unemployment insurance and a variety of alternatives. Another solution for employers, or an important point, I don't think we have it in our guide yet. We're updating that several times a day as new information becomes available, but extensions in filing for taxes, or filing your taxes, both state and federal, but employment taxes, which are at the California Employment Development Department, are routine. There are opportunities as you're trying to manage in a crisis to get an extension on filing those. Disability insurance, if we get to the point where workers are impacted by illness, not only is there unemployment insurance, not only is there sick leave if the employer has it, but there's disability insurance. And there is also a robust California program for paid family leave for caretakers, family members, should we end up with that kind of disruption in families trying to access or take care of themselves. Not quite finally, but almost finally, let's talk about access to capital. So first, Economic Development Collaborative, Women's Economic Ventures. We have loan funds available at around 4 to 5% in loans ranging from $5,000 to $50,000. It's a fairly easy application. We're looking at standards that are not as severe, of course, as banks. The first thing we want to do with a business that is struggling is to help them access commercial credit, but we understand in crises and times like these when it's difficult to access capital and difficult to document losses, there are resources out there, and we can facilitate business access to capital. The larger pool that we're trying to get workers into, or businesses into, excuse me, is what is referred to as the Small Business Administration, excuse the term, they call it economic injury disaster loans. You may remember this term from the Thomas Fire and others. You didn't get burned, you didn't lose inventory, but you lost sales because people are staying at home, thus economic injury. There was a sort of eligibility snafu in the manner by which the federal government rolled this down to the states. So the initial information that came out about a day ago showed that Santa Barbara was not yet eligible as a county for businesses to participate. We believe that has been resolved, or at least will be resolved in the next couple of days. They created this odd and unusual thing, understandably perhaps because this is not just a localized disaster, but a national disaster. The way that a county qualified, just to clarify this, is at least 5 businesses had to go to the county's emergency services site and say they've got business interruption problems. No one told them to do that. That's not necessarily the first place you go. If they didn't do that, somehow it didn't end up meeting the criteria. But now that everybody understands that, we're meeting the criteria, making sure that businesses in Ventura, or excuse me, Santa Barbara County, Ventura, et cetera, are eligible for disaster. So what that is it's up to $2 million in money available up to 30 years. The rates for nonprofits, and again, I want to emphasize the nonprofit community is eligible for this funding, showing losses, 2.75%. Businesses, I believe, are availing that at 3.75%. To get that money, you're going to have to document your losses. You're going to have to show that you've got some regular accounting and understand where you're at. You got to be somewhat, you got to show that at least you were break even perhaps in the last year. But the standards for these are not the usual underwriting standards that are very difficult and challenging for small business to meet. This is an incredible product that the federal government makes available, and we hugely encourage people apply.
So it's a federal program, the Small Business Administration program.
Mm-hmm.
Okay. And since I interrupted you, Ms. Harmon has her light on. I'm trying not to interrupt you.
I got like 1 minute left and I'll be quiet. Let me just make a couple of last quick points.
Okay.
So We want to make sure the following, that businesses throughout your community get access to these services. We encourage you to go to our website, to Weave Online, to work with the chambers and others to make sure that you're referring businesses, because there are resources that we can provide. To make sure the businesses engage with us before they make decisions, so that we might be able to provide some context and resources. We wholly understand that with the business interruption in restaurants that is going on, we also want to work with you and others to encourage citizens, residents to continue to be faithful consumers of their favorite service and businesses and restaurants, because we want, whether it's pickup or delivery, we want to make sure that these businesses have access to some customers and revenue, helps them survive, it helps the community resilience. Finally, we wholly understand that every impact to every worker and business is unique, and we appreciate that. We do have some experience in this, however, with the last several disasters. There are resources, and we're just eager to be a partner with you and appreciate your attention to this and eager to help. Thanks.
Okay, Ms. Harmon?
Thank you, Madam Mayor. And thank you so much for putting all this information together. I know this is a very difficult time for our businesses. I just had a couple of questions for you on specifically the assistance available to employees through the state EDD. And I get these questions a lot, so I just want to confirm with you. You're only eligible for disability, unemployment, paid family leave if you're a traditionally paid employee, i.e. you pay payroll taxes. Is that correct?
That's correct. Now, during the prior disasters, there was a particular program that the self-employed were able to access unemployment insurance. To my knowledge, that has not yet been triggered. We've been in contact with the state on a daily basis. We anticipate that that will be in place as an extension of the larger disaster unemployment insurance program. Okay. Don't quote me on that. We're knocking on the door. We know it's been available in previous circumstances. I would encourage two things. There's a local employment development department. Mostly that's hotline number. We've included it in there. And the Santa Barbara County Workforce Development Board, Ray McDonald and staff are able to answer a lot of these questions as well.
Thank you. And following up, and I appreciate that, and I will certainly watch for that, because I know a lot of our neighbors are worried about that. And if you are undocumented, I know that you can make a paid family leave and a disability insurance claim, but not unemployment. I believe I have that correct. If you're undocumented in previous disasters, have you been able to access that expanded fund? Do you know? Not to my knowledge. And I know that in Ventura County, and I believe Santa Barbara had a similar parallel, the Ventura County Community Foundation created what they referred to as the Undocu Fund. And tried to create a parallel program of making sure that with the right sort of inputs and community outreach that we were collectively trying to make that resource available for the entire workforce that is resident here one way or another. That said, I am not an expert on those particular issues. Thank you.
Ms. Sneddon?
Thank you, Madam Mayor. Thank you for being here to answer our questions. So I'm just going to ask you three sort of specific questions that I've gotten through email, and then maybe you're a resource for this and maybe not, but maybe you have some suggestions. Okay. So one had a constituent write in saying he was interested in donating money to other businesses, and is there a fund or a place to help support businesses through donation?
I don't know. I would recommend connecting with the the Santa Barbara Community Foundation or United Way, and United Way might be the best solution on that. During prior disasters, I know United Way was amassing a variety of donations, cash and other, and resources. I can say that in this case, any number of resources made available would be, I'm sure, hugely available, especially monetary.
Thank you. And then the other, they're related, but farmers market, fisherman's market, a lot of available produce or food, and they want to be able to get that to the community.
Yeah, and I hear you loud and clear, and I don't know the answer to that, Mayor Pro Tem, but I know that there has been a real crisis in food banks and food distribution networks with volunteers who are very much the capacity for making that work is not the labor force available with social distancing recommendations and so on. So I know that is an anxious point. I'll see if I can find some information and get it back to you, but I don't know exactly what are the connections to help make sure that those valuable things get to families.
Thank you so much. And this is an incredible resource here that you've put together, and now I know where to direct people for these answers. Thank you.
Mr. Stensley, let me ask about business disruption insurance. We've had a couple of questions about that. So I think some businesses have purchased that protection, others have not.
Yeah, so we absolutely encourage businesses to get that rider, to get that extra coverage, especially after the last rounds of fires and what we anticipate going forward. I wish I were in a better position to tell you otherwise, but I believe just about all those policies have an exclusion related to pandemic and such things. So that said, we're still encouraging businesses to, if they didn't, it's too late for this disaster to purchase perhaps that insurance. I don't know that for sure. We still encourage businesses to purchase it. And we do believe that from dialogue that we're having on a regular basis with the California Insurance Office and others, that there may be other resources that the state or federal government may make available that sort of run parallel to that. Again, I think it's absolutely critical that a business that has the insurance reach out to its broker, understand what its limitations are, maybe even make a claim even if they think it's going to be denied, because I think that's an important step of documenting that the business is being responsible about availing itself of all of its opportunities it can.
Because the governor or the insurance commissioner might provide relief. It's a possibility.
That's a possibility beyond my pay grade, of course, but similar things have occurred in other, kind of parallel to that in other disaster circumstances, yes.
So a big part of our discussion yesterday with Ms. Johnson, with the small business owners, was some of them lease space. So there's two entities. There's the property owner, the building owner, and then there's the business owner who's the lessee. Is there relief for the property owner so that they can pass on
That's
relief to the
yes,
person
to the
leasing
degree
the
that the
space?
property owner is identifying the leasing of that property as their business. Right?
Okay.
So in that regard, they are also a business, and we would consider them as such. The complications of trying to replace lost rent and so on, that gets way more complicated, and I'm not sure. Property owners also have insurance relative to their tenants, and I would encourage a property owner to look at those clauses extremely carefully as well.
Did we learn lessons from our fires and debris flow? And well, I guess that's a general question.
I believe we learned a lot of lessons, and unfortunately not all of them are entirely applicable to this circumstance. But I do believe several things, and trying to be maybe just a little optimistic, is that businesses, I think in general, are much more in tune with the notion of managing their business as the notion of interruption is a part of the regular routine of managing a business. It is not the unusual, it is the usual. And business owners, small business owners in particular, tend to be master problem solvers. And so in our counseling with businesses, we're not just trying to solve a particular problem in access to capital or identifying a foreign market, but about being resilient and light on their feet and strategic in general. And that's not our counseling, but I think it's a general lesson learned by businesses that interruptions of all kind, disruptions of all kinds, are in fact the norm, and you need to be prepared for them. I don't believe that everybody is prepared. No one believes that, but I do believe people have learned a strong lesson to be leaning in that direction.
Okay, and in terms of interest rates, did I read that they've been reduced to zero? And is that something that business people can take advantage of?
That's important to the degree that people are managing various rates of commercial credit and lines of credit, especially for businesses. But accessing a new loan, generally the rates of the U.S. Small Business Administration in its disaster lending are set between that 2.75 and 3.75. We, as an alternative lender, what we do is we amass capital either from the U.S. Department of Commerce or from private banks or other institutions, and we lend it independent or in partnership with them. We're lending disaster money at somewhere between 4.25% and maybe as high as 5%. What we want to do is move people into the lower cost money. But we are looking at our lending, frankly, as a bridge to, if a business needs capital now and they're not able to make the case for an SBA loan, they should apply with us or Weave, and we can help bridge them until they're eligible to get longer term, higher finance, lower cost.
Thank you. Councilmember Jordan has a question for this gentleman. Mr. Jordan?
Actually, I was just going to clear up, it is a little bit in my pay grade, the fourth largest broker in the United States. Just to get down in the weeds, he's absolutely correct. Everything I heard you say was absolutely correct. What's most important is to document and do report. But business interruption is a property coverage that is triggered by specific types of perils, property coverages. And in fact, the reference to the Thomas Fire, every one of those claims was initially denied by the carriers because there was no coverage under a property policy for a mudslide or that type of thing. They eventually were legally able, at the governor's insistence, to make the nexus between the mudslide and the property peril of a fire weeks before. And that's how that evolved. So what will hopefully evolve out of this is there will be political pressure on the industry to recognize this particular type of loss that can be handled by the insurance carriers. But documenting is really, really important, and documenting in real time, because my house went down today. I can't tell you how many pair of underwear I had in the thing unless I think about it today. I won't be able to handle the horror of a week or two later. What really happened to my employees? What did it really cost me? Who'd I let go? Who'd I keep? Really important to keep a journal as you go along right now so that if the opportunity presents itself, you can recap the dollars, the situation, what you did, what you didn't do, that type of thing.
Right. We're going to use you as a resource then. Okay, Mr. Stensley, thank you. We're going to go to public comment because I don't see any other lights on, and some questions might come out of the audience participation. David Potter?
Madam Mayor?
I'm sorry.
I'm wondering if you might want to hold off on public comment till we talk about the
Oh,
urgency
did we finish?
proclamation. Yeah, we still have more to present, and I'm not so worried about the ending when we talk about city services and stuff, but we have an emergency proclamation to discuss as well. I think it might be appropriate to take a public comment before you vote on that, but
There's
have the
more.
benefit of
Okay. To you or to the chief, to Mr. Kalan? Ms. Johnson.
Madam Mayor and City Council.
Okay.
Nina Johnson. So just want to echo what Mr. Stensley said, that we are going to be working with the county to quickly help connect and access the small SBA loan funds to help any business who are interested in accessing those funds. And also just to reiterate that we're going to continue to meet with stakeholders and business organizations, a small business recovery team to identify some short-term steps and start preparing for how we get through this entire situation and come up with the resources different businesses need right now and then planning into the future. From here.
Yes, thank you, Madam Mayor. So what I'd like to do is spend a little bit of time on this slide and have some dialogue with the council and potential action as well, and maybe take public comment prior to that. As you are aware, Santa Barbara County did declare a local emergency for the county. Generally, county declarations do apply to cities as well. We're kind of under that umbrella for purposes of emergency response and also disaster relief from state and federal government. How often? Oftentimes a local government will adopt their own local emergency proclamation just out of an abundance of caution and to give us some additional tools and resources to address that. So yesterday, under my authority given to me, I did sign a declaration of a local emergency and signed that yesterday. However, for it to continue forward, it requires your approval as well. And so we're bringing that to you today. And I'll let Mr. Kalan go through some of the highlights of what's included in that. But a couple key ones is that this gives me the ability to use our city employees to help take actions directed or recommended by the county public health officer. And so the conversation you've already had today, if eventually we get to the place of looking at bars and restaurants or something, if the county public health officer declares, I can authorize the police and fire department as examples to kind of help enforce that order as it comes through. We also have a very fluid situation with regards to board and commission meetings. How do we safely have them, both for our volunteers on the boards and commissions and also for the public to access those meetings. And so this emergency declaration allows me to postpone or continue board and commission meetings until we get the technology in place to be able to conduct those that are necessary to do in a safe manner. At this point, I'll turn it over to Mr. Kahlon and let him follow up with any other details before we ask you.
Thank you.
Thank you, Mr. Casey. Let me pass these up. I know the council has seen this draft resolution, but I want to make it available and for the public. Here are some copies. As Mr. Casey said yesterday, he signed an emergency proclamation. Under your emergency services structure, a proclamation signed by your Director of Emergency Services, that's Mr. Casey, can last 7 days. So if you look at the exhibit, the local emergency proclamation, you'll see that in effect we declared, Mr. Casey declared an emergency, but he also said an emergency existed going back to 5:45 p.m. Thursday, March 12th, which is when the county's public health officer declared a local health emergency, and likewise is when the county of Santa Barbara declared its own local emergency. So the council has to ratify this before Thursday at 5:45 p.m. for it to remain effective. The operative provisions of Mr. Casey's proclamation do, as he said, empower city employees to do not only what is directed by the public health officer, but what is recommended. You heard Dr. Fisk being very careful, describing conditions that were mandated versus recommended versus not yet ready for prime time, in his opinion, here in Santa Barbara. By adding the phrase recommended, we've broadened the authority, or Mr. Casey has broadened the authority of city staff to do the next latest and most important thing that the county recommends or directs. Now, going to the front of the resolution, which is what is new, I want to call your attention specifically to sections 5, 6, 7, and 8. Section 5, as I mentioned, repeats Mr. Casey's requirement that city officers' employees shall take the actions directed or recommended by the county public health officer to prevent or mitigate the COVID-19 emergency. Section 6 addresses the Brown Act, and it's essentially your direction to staff to recommence city board and commission meetings when we can do so safely with teleconferencing, and not until then. Section 7 is a very important Swiss Army knife section, and I know the council has brought up already today several areas of concern. Section 7 empowers Mr. Casey, the council would be empowering Mr. Casey to adopt supplemental proclamations and orders. The idea here is that we assume we will see the council on a 7-day cycle, but you want to empower Mr. Casey to take action in between meetings as appropriate. You will see finally, though, that section requires reporting back to the council at the next regularly scheduled meeting should Mr. Casey take an emergency action. Finally, Section 8 really is directed in part to our fire chief and launches our emergency management system into place. My understanding is that Mr. Casey ordered the Emergency Operations Center open last week, and that's what we've got. So there has been quite a bit of talk around the state of different forms of resolutions and declarations. I've looked at quite a few. Many of them do a lot less than what the newspaper is reporting, because there is great confusion between what the governor has directed, what the governor has suggested, recommended, or guided on. And what we've tried to stay to here are the actions where the county public health department has made a specific direction to implement. I'd be happy to answer questions.
And Mr. Kahlon, if you could explain the parliamentarian procedures for council to be able to act on this in an emergency manner.
I
Okay.
briefed you all when I gave you orientation on this day, and thought it might never happen, but it has happened. The Brown Act does allow you to take action on items not listed on your agenda in a couple of circumstances. The circumstance today is laid out in Government Code Section 54954.2, B as in Bravo, 2. And it says that upon a 2/3 vote, that's 5 of you, you may determine that there's a need to take immediate action, and the need to take action arose after the agenda posting Friday. Here, the need to take action is that Mr. Casey's proclamation will expire Thursday. He did not take action to approve that proclamation until yesterday. So the need to take action arose after your agenda posting Friday, and there's a need for immediate action because the emergency will expire if you don't act by Thursday. So the motion before the council, Mayor, should you so desire, is a 2/3 vote, motion second, 2/3 vote, to add consideration of a resolution of the Council of the City of Santa Barbara ratifying and proclaiming the existence of a local emergency.
It's at the top. Okay, so that's what the motion should sound like.
If you wish to discuss this further.
Okay, and then we might want to add more to this depending on where our discussion goes. Can I pose a question? If there's 10 cases in the city of Santa Barbara tomorrow or the next day, and we want to take action of some kind, how would we would be giving you the authority to go ahead and pursue that, Mr. Casey or Mr. Kawan? Is that what this is? Will that?
Yes.
This will help that process?
Yes. The purpose of this delegation of authority is to make sure that Mr. Casey knows his job is to adopt supplemental proclamations and orders which are necessary to respond to the local emergency.
Okay.
Provided that actions which would otherwise require council approval shall be reported to the council at the next regular meeting. So
Okay.
If we come across an issue that requires immediate council response, we have the authority under the Brown Act to call you into session quickly.
Okay, let's go to the council, Ms. Sneddon, and then Ms. Harmon.
And Madam Mayor,
Oh, go ahead.
I think the advice from the city attorney was to take a vote to have a conversation about this resolution, which then allows you to have the debate and stuff. So I think we're looking for a motion of 2/3 of you initially.
So move.
Second.
Okay, so that would be Friedman, Sneddon to open a discussion. All in favor?
Aye.
Aye. Any opposed? Okay. Will you start the discussion for us?
Thank you, Madam Mayor. Are we at discussion or are we just at questions right now? At this-
Either one.
You don't have public comment on?
We'll do public comment afterwards.
Okay.
So question. and
Okay, I
then-
have a question.
Okay, go ahead.
I also have discussion points. I just wasn't sure if it was the time. So for the question, wherever it says actions directed or recommended by the county public health officer, what if we want to take action beyond what is recommended by the county public health officer? What is our authority to do so? What would be the protocol? How would that happen?
When the city council declares an emergency, you have authority to take actions necessary to mitigate that emergency. So you can be creative and add to the list if you wish. What Mr. Casey and I have been suggesting, and actually Dr. Fisk as well, is that your actions be guided by a physician. So the emergency declaration from the county was driven by the public health officer. The framework of this resolution would leave the public health officer with that obligation. So, two things. If the council has some medical evidence that warrants doing something different, you can go ahead. Secondly, in this resolution or otherwise, you could direct us to correspond immediately with the public health officer to request further actions that you think are important. given the concern about coordination and communication, whatever you do, I think we need to communicate to the public health officer.
Thank you so much. And then one more question about, that's not included in here, is that's come up as landlord-tenant eviction protections. Would that be in this stage?
Madam Mayor, Mayor Pro Tem Sneddon, the City and County of San Francisco enacted tenant protections by an executive order of the mayor. The City of Santa Monica has done it by a proclamation of the city manager. Until Governor Newsom's executive order last night, I was of the opinion that we had significant preemption problems that because the way these laws are working is to prevent a landlord from going to court to recover their money. Governor Newsom's order of last night solves that problem. It says that not that the state is mandating no eviction for people who can't pay residential or commercial rent because of coronavirus. It says that the state is taking away its preemption that prevents you as the city council from doing so. So that leaves you to do a good job of it to avoid injuring property owners in a way that would make them want to go to court. So long story short, I need a week to draft it. If you want us to go ahead, I would strongly urge, our whole office would strongly urge an ordinance that can be enforceable in court. I need 1 week to do that, so that would necessitate a meeting next week.
And so that would be a separate motion and a separate item. Okay.
Oh, okay. Would you like that now or after discussion?
It wouldn't be incorporated in this. It would be
Right,
separate.
okay.
So keep on with this, and then we'll take up
Okay.
the eviction issue after.
So I'd like to voice that I would like to see that happen, so we'll reserve that as a motion for after this item. And then I would also like to just voice that I would want to reserve the ability to request further action beyond what the county public health officer is recommending, should we have evidence that that is required, and I want us to be able to be nimble on that. So I'm more in discussion later. I don't want to preempt discussion, but just that answered my questions, and those are my concerns.
Okay, very good. Ms. Harmon, you're next.
Thank you, Madam Mayor. My questions were mostly covered, but following up on that very last point, I just want to double check with you, Mr. City Attorney. Assuming that we pass this emergency ordinance as is, we're not in any way limiting our ability to take steps beyond that which county public health takes at some future date, right? My concern is Section 5 saying that we shall take actions directed or recommended by the county public health officer. If on Wednesday, for example, as Ms. Sneddon indicated, we decide as a council we want to do more, and perhaps county public health is not there yet, are we foreclosed from the possibility of doing more by supporting this executive ordinance, whatever it's called, or do we still have the capacity to take that, greater action were it to become necessary?
Madam Mayor, Councilmember Harmon, you still have the authority to go further. And let me give you a specific example. A good chunk of today's presentation was on the economic consequences. We're certainly not going to need to defer to the health officer on economic recovery. So those kinds of issues will be coming to you as the consequences of this present crisis unfold.
Certainly, but I guess the elephant in the room, I'm thinking about mandating some type of modified closure for restaurants, for example. That has a specific nexus, of course, with public health. Were we to feel it is necessary at some future date, would we be limited by this in taking that action in the future?
Madam Mayor, Councilmember Harmon, I'm not a physician. I did hear Dr. Fisk say that presently the circumstances in the Bay Area are not present in Santa Barbara. But I inferred, and I think he intended us to infer, that they may exist here at some point. And we will need to act, I assume you will need to act when and if it's appropriate. So yes, nothing in this document prevents you from changing how you approach the crisis down the road.
Or from diverging from public health at some point if that were to become necessary and we were able to make those findings? I guess I'm just trying to understand in what ways this limits us, if at all. Maybe it doesn't.
The caution you're hearing from Mr. Casey and myself is that none of us are physicians, nor do we have any physicians on the city payroll. Dr. Pruskowski is our medical director for fire, but we are not the public health officials for this area. So we're very uncomfortable making judgments about the appropriate public health actions.
I understand. I'm not asking you to do that, and I'm not even asking, I'm just saying this order, does it have any impact on our ability to take any action in the future?
Absolutely not.
Great. Thank you.
Mr. Jordan?
Well, I really had the same question because, Mr. Cologne, what I heard you say earlier was the choice would be evidence to move forward versus communicate with the public health officer. That was the way you framed it. And that's not what you just said now, because you said if we wanted to do something, we can go do it. And
with evidence from a physician,
all right,
that's what
so
I said.
that's what I exactly want to hear, because the devil's in the details, and you don't get a lot of real details from the people visiting at those tables because they're working somewhere else than City Hall. So that's uncomfortable to me too. So I see this as or I would like to see this as an opportunity to give us the flexibility to say that maybe the Bay Area made a mistake and are in the situation they are because they waited too long, not as an example of when we should take that same action. So how would we get there?
I can't point to a case or tell you with absolute certainty that you have to have medical opinion to do it. So you can do it today if you want, it being closing all restaurants and public places. That is within your authority. The concern that you've heard publicly and privately from your staff is simply coordinating that with our public health officials who have really charged at this pretty aggressively as far as we can tell. So you don't, strictly speaking, need to have the physician's evidence, but it's an extremely valuable fact should someone challenge a regulation, particularly on the economic displacement for tenants. I'll say the obvious. If a tenant's not paying rent, that means the property owner's not receiving rent. So there's an economic dislocation that will be mitigated on one hand and exacerbated on the other hand. Those kinds of decisions need some facts typically. And that's why I am advising some caution in emergency actions. We've been discussing this actively since the county broke out last Thursday, and we have been confident that every day will bring new information, and that flexibility and agility are critically important. So we have not been wanting to anticipate major policy decisions like shutting down every restaurant in town. That's a very significant issue.
I agree, and we're only using it as an example for me to talk about this right now too. But the scenario you just explained with the county is also one that causes the most angst, is that it's blue one day and it's yellow the next day. And it seems a reasonable mind could have seen you changing the colors the day before to the next day. We could walk away here from here today, and tomorrow morning the county could say all restaurants, we are saying that all restaurants should be shut down, and it just seems like we're the tail following the dog right now while we're looking at this. Everybody's either right now a mitigator or a contributor, right? And the goal is to get everybody you can into that mitigator column and not a contributor. And to me, that just seems what I would like I'm sure we're going to have more discussion here, but my goal is to be in a role that we move as many people out of the contributor column as possible, as soon as possible, and that we do that in a manner that is fair and reasonable. So, I'll let you all discuss some more, but that's kind of how I feel about it now.
Could you be a little more plain speaking? So you want us to take action to close
I don't know. I would
restaurants?
like to discuss what that looks like. I'm interested kind of globally in rentals and eviction issues. I'm interested in gatherings of people in spaces. I mean, everybody's focused on restaurants now. Are we focused on churches? Are we going to talk about Easter? I mean, there's all these situations coming up that, in my mind, are contributors. It's not necessarily just restaurants. It's not the presence of alcohol. It's not the presence of food. It's just where people are gathering, and is it still just logical to allow that to happen while we're looking at the ramping up of this pandemic? So.
Right, and I can assure you that county officials are listening to our discussion now. So if we have concerns about that, we should voice them here. They might be looking for us to say, we will support you if you want to take an action that to some people might seem drastic, but other counties, specifically in the Bay Area, have taken those actions. So I'm hearing you. I think, okay. No contributing anymore. Okay, got it. Mr. Friedman and then Ms. Harmon.
So I have a few questions, but the first is a procedural question just on how we're debating here. We haven't had public comment yet, and I don't know if we're supposed to make comments or ask questions right now before we have public comment. Usually we just are in the question.
Yeah, let's keep on. You're right. Let's keep on with questions.
Okay, so I'm going to hold my comments, but I do have some questions.
Okay.
The first is, should we go forward with this emergency ordinance? Would we be signing away any authority that the council has to the city administrator? And by that I mean, say the public health department tomorrow were to say all restaurants need to close. By this ordinance, Mr. Casey could then do that, but then would we have the ultimate review when it comes back to us, or is his decision final?
Oh, good question.
You would have Madam Mayor, Councilmember Friedman, the council retains the ultimate authority to change any action we take. The point of this authorization to Mr. Casey is so that he can act instantaneously when county public health says it's necessary.
So just for the public watching at home, it allows us to respond, be more nimble and respond quickly, but then we would have that discussion at the next regularly scheduled council meeting to show that we concur with it or if facts have changed.
Correct. This is a direction to him to comply with both the orders and recommendations of public health.
And can you, Mr. Kulon, can you explain some of the differences between these areas that have taken more extreme measures, such as Santa Cruz or Santa Clara County, San Francisco, and specifically in terms of what their relationship is between their public health departments?
Okay, well, right. That's a good question. Many people may not understand that counties essentially own public health administration in California. Counties are considered political subdivisions of the state. They are both funded and charged with the obligation of taking care of public health. So the legal structure the county invoked last Thursday was twofold. One, they approved an emergency declaration, much like Mr. Casey did yesterday, subject to ratification by the board today. Secondly, and independently, the county public health officer issued mandatory orders enforceable by the sheriff or Santa Barbara police on a couple of points. So the advantage of the public health officer is that state law has a very crisp enforcement mechanism meaning public health officer calls the sheriff and the police chief, and the problem is solved immediately. That's the structure built into California. In addition, the county has the funding for things like mental health, homeless care, which are all adjunct issues related to this.
So along that, if we were to take an action outside of or beyond what we just heard from the the cottage today, but where our public health department is in terms of potentially closing restaurants or other facilities, how would we enforce that? One, and then two, are we at any risk as the city that we made a decision not based on the facts of that public health, the data that public health presented to make that declaration? So could a business potentially, we have liability with a business that says you're not basing it on the data of the public health department and the medical professionals and scientists that are making these decisions?
Madam Mayor, Councilman Friedman, let me take the second question first. I think it'll be a tough slog for anyone trying to bring litigation around public health right now. We have certainly national awareness, maybe national panic, maybe national irrationality. So I think that people will accept the need to behave in ways that our civil liberty-driven society is not necessarily used to. We're going to constrain our activities voluntarily. The means of enforcement would be the city police. There's a third option I neglected to mention in response to Councilmember Jordan. I want to put it out there. It is well within the council's authority to include in this resolution specific requests or even directives, meaning a strong request to county public health to take these actions or to make them uniform.
Very good. Oh, go ahead.
Meaning that if the council is uncomfortable making these orders itself, you can certainly use this legislative document as a way of communicating your concerns to the county. And in fairness to Dr. Fisk, what he said is being proactive should be first and foremost on our minds because that's what it will take to flatten the curve. But what is proactive in one community may never apply in another community. Decisions need to be driven by evidence based on what the virus is doing. No shelter in place in Santa Barbara is warranted. He contrasted Northern Italy. Now, in fairness to him, he repeatedly said that he's not the public health officer. So
Right.
I don't know that that statement would preclude you from doing something.
Okay, that was clear. We still have another part of our presentation, and the public's been waiting, but Mr. Casey, can we ask our library director to come up, or what's next in the presentation?
It's certainly at the preference of the city council. I've got a remaining part of the presentation where I was just going to talk about some of the actions we're taking as a governmental entity to address the situation, but it's more informational in nature. If you want to stay here on the substantive action of the day and work through that and make decisions, then we can wrap that up. That might be my recommendation, is to do that and then let us wrap up with the informational part at the end of the session.
Okay, because that's more informational, the other part. Okay, so we'll wait on that and take public comment at this point. Thanks so much for waiting, folks. And it's an emergency and there's a lot of things to talk about. So David Potter, thank you for waiting. Magan Kunim, after you, Sherry Villanueva, Julia Mayer. And I think Michael wanted to talk on this subject, and you too. Okay, got it. Thank you.
Okay.
Go ahead.
Thanks, everyone. My name's David Potter. I've got a winery, 2 tasting rooms in town, and 1 in Los Alamos. I'll be brief because everyone's got a lot going on. I'm just here to be heard for the most part. We want to do the right thing, so as of Monday, we've closed operations completely. Nobody coming in the tasting room, nobody going out. Part of this has meant laying off all of our part-time, hourly employees, which obviously feels terrible. We're scared. Business has stopped. And 1 month is feasible, which we've learned from the Thomas Fire, but 3 months without revenue is probably impossible. So I guess I realize that the city doesn't necessarily have all the resources to bail anybody out, but what I'm here for is I'm looking for advocacy and leadership on our behalf. Things like eviction protection, advocating to the city, the California Insurance Commissioner for a universal business interruption coverage. I'm one of the people that I've been paying for business interruption coverage, but there's a clause for viruses and pandemics. So my brokers said to me that it's not covered. Well, I'll follow the advice and still file the claim, but we're in that position. And yeah, I guess just keeping communication open with the public. I mean, to this point, I haven't really seen any statements or communication from the council. I saw an email go out yesterday, finally, from the city email account. But we're stuck, and our bills haven't stopped, but our revenue has. So that's where we're at.
What was that last part again?
Our bills haven't, our
your
bills have not
bills.
stopped, but the revenue has. Now, to be fair, a shout out to Montecito Bank. They've been super proactive in working with us for loan payment deferral options and things like that. But the big thing's going to be working with landlords, and I think most of my small business colleagues are worried about how that's all going to shake out. So,
Thank you.
thanks.
Ms. Kunis? Cunin.
Megan Cunin from Cunin Wines.
Excuse me.
No,
that
it's fine.
I didn't.
Thank you for seeing us today. It's great to be here. We've been talking today as if it's theoretical as to whether small businesses, restaurants, bars would close. And I just want to tell you that as of Monday, voluntarily after Governor Newsom made his recommendation, I think almost all of the 25 tasting rooms in Santa Barbara have closed. We've shut our doors voluntarily to be part of the problem, to be part of the solution, like you were saying, to be on that side of the column. Again, my name is Megan Cunin. I'm a Santa Barbara winemaker. I'm a business owner in the Funk Zone, where I've operated 2 tasting rooms starting in 2008. Since then, I've survived and have grown my business through financial crisis, the mudslide, the fire, the death of my husband, all of which were great challenges. But during all that time, I never faced such a seemingly significant challenge to the life of my business as the one I face today. And again, as on Monday, I, like my fellow wineries, did the unthinkable and shuttered both of my tasting rooms. I did it for the good of the public and for the good of my employees, so as not to exacerbate this problem, to flatten the curve so none of them got sick. They're small, intimate settings where, again, people are touching glassware, people are touching the bars. It's impossible to keep them clean enough, I think. And so, again, we did this voluntarily, but this means I have 0 revenue now, because that was my business model, and a full set of bills for the foreseeable future. Immediately, I'm struggling against odds that nobody, and so many businesses are in Santa Barbara, that nobody can predict. You'll hear from Sherry Villanueva. She also did this. We felt we had an ethical responsibility not to expose the public, but we have, we're facing something that's like unthinkable. It's huge. So I say, in the past, supporting local Santa Barbara businesses during these crises has meant drawing in the community and encouraging them to drink local and eat local. But when you're shuttered, that's not an option. So a couple of things that you can do, at least for me. I do have a business interruption policy that does not exclude a virus as a force majeure. If there was a mandate, as opposed to a directive, I would know that my business would survive. Right now, we don't know how long this piece of string is. How long will we be shuttered? How long will we not see the public? To what extent can we reinvent our businesses to hope people drop by for a case of wine or reach out to our national fans? It's just, I think if we don't think hard about this and take action, at the end of it, Santa Barbara will lose a lot of businesses. We all work on very, very thin margins. We work very hard, but there's no way we can predict how long we can hold our breath in this situation. So again, following Mayor Garcetti of Los Angeles and Mayor de Blasio, and New York State to make at least the closing of tasting rooms, which have already voluntarily closed, a mandate, might help other people. My broker told me that he represents other wineries in our region, and so they could probably get business interruption insurance. The other thing that I think that we need to do as a city council is to put in place some kind of statement encouraging landlords to give tenants like us like really broad terms. So in essence, like not only eviction protection, but maybe rent forgiveness. I mean, I think our landlords have been open to that, but rent forgiveness, not just delays, because how many of us can actually go into deep, deep debt in order to stay in business? If this, you know, my monthly nuts can be like, well, very, very significant, and it could ramp up very fast. So I'd ask for you guys to consider that. And then lastly, it's great for us to be here today, and I'm sorry I haven't come to city council meetings before, but to make meetings with local businesses a priority and more inclusive and more often, because this is a giant problem that Santa Barbara is facing right now. It has already happened. We already do have closures. We already do have, you know, our small businesses, which make up the goods and services for everyone in this community. Small businesses are already hemorrhaging money and are really fighting to survive. And so we just wanted to come in and say our piece and hope that you can assist us.
Well, don't go away. Ms. Sneddon has a question, but I did want you to know that Ms. Johnson and I, the small business work that we're doing will eventually include a bigger workshop where, well, we can't meet in person. Maybe we'll do a teleconference, or we'll figure out a way, like you're saying, to meet with businesses. We need to hear from you.
Right.
But you're also saying that if you had a mandate to close, that would fulfill something in your insurance?
Yes, definitely in the case of my insurance, but really, if there was a mandate to close for at least the businesses in my sector, we would probably have an easier time negotiating with banks and landlords who would understand it's a hard close. There is no revenue coming in. And, you know, if it seems voluntary, we're not going to get the kind of respect or consideration.
Okay, we are working on that. But Ms. Sneddon, go ahead.
Thank you for that clarification. It's really important for us to know that a mandate is helpful as opposed to a suggestion. How does that affect delivery options?
Well, you know, simply we weren't in the delivery business. We have a winery for 20 years. We make wine and we sell it to the public in Santa Barbara. We're part of, you know, one of the attractions. We were one of the first wineries in the Funk Zone. So I can still deliver to people. But the way I got people into my wine club and the way that I would entertain people in the public has just vanished. So we can sit on the phone and call people outbound and put a special on the internet, but that's never going to match our day-to-day business.
Oh, I wouldn't think it would. I guess my question is I wouldn't want to limit your ability to continue delivery services as a source of income.
Right. No,
by
I mean,
closing.
Because we always had a wholesale side of our business and a mail order side of our business. So I don't think that would affect our insurance claim for our over-the-counter retail business, which is what we're closing. We're closing, you know, our over-the-counter tastings to the public, which is, I think, what would cause a risk to our employees and to the public.
Thank you.
Sure.
Thanks. Ms. Villanueva, come on up.
Again, all to City Council, thank you for allowing us to be here. My name's Sherry Villanueva. I am an owner of 8 restaurants in Santa Barbara, 7 in the Funk Zone, 1 right down the street from here. As Megan mentioned, we voluntarily closed all of our operations on Monday in an effort to protect the community and our employees. It was mentioned earlier there are 5,000 food and hospitality jobs in the county of Santa Barbara. As of my business yesterday, there's 350 less. So I had the horrible job of laying off 350 people, excuse me, many of whom work 2 full-time jobs to live in this county, many of whom are primary breadwinners for their family. They're hourly employees that are dependent upon their jobs in my restaurants. One of the issues that we're dealing with is medical insurance. We insure all of our employees, paying for medical insurance for those employees at a time where they can't afford to make premiums themselves. The idea of employees having no medical insurance during a global pandemic is really a very weighty idea to keep you up at night. So right now we're trying to figure out ways where we can cover medical benefits. We've as a company are covering those benefits through April 1st. We can't afford to cover them after that with zero income coming into 8 different restaurants. One of the things I just wanted to reiterate is that speaking directly to small business owners, Megan and Dave have both mentioned that as well, is critical because we are in the trenches and on the front lines. A lot of information is out there, and it's easy to feel like there are all these great safety nets and support services. I'll just give you an example with unemployment insurance. Unemployment insurance is great. It covers a fraction of what the typical income would be. Again, you're talking about families who live paycheck to paycheck. They are desperately trying to stay in Santa Barbara County, to work in Santa Barbara County, send their children to school here. They can't live on a fraction of their paycheck. We set up a sort of triage desk in our bakery area so that we could answer employees' questions. The entire EDD website has overloaded. It's completely gone down. You can't apply for a claim. There's no one there to answer your questions. So again, you're an employee living paycheck to paycheck. You're now facing getting 20, 30, 40% of your income, and you can't even get access to that. So we're grateful that there's unemployment benefits. It's just not enough. It's certainly not enough to make medical premiums. SBA loans, also a great idea. And, you know, after the Thomas fire, we did a lot of investigation in our company looking into SBA loans. They all require a personal guarantee. So now for my business that I literally work 80 hours a weekend for the last 10 years, I need to put my family home on the line. It's very stressful for a business owner to take on the extra. It's not just your business that you're risking. Now it's your family and everything you personally own. So it's not as simple as, oh, there's SBA loans that are cheap. You can rent out and get those. 15% of Santa Barbara County residents live in poverty. You know, a lot of them are working poor. They're working in hourly jobs in hospitality in this community. So it's a very, very, very serious problem. There's a lot of conversation around pickup and delivery. We spent a week developing a program to do that. After looking at all the numbers, we would lose money doing that. We can't. We wanted to do it just to serve the community. How can we do it just to provide a service to Santa Barbara? And at this point in time, we can't subsidize a service like that. Our business can't afford to do that. And so we had to make, and again, I'm like, well, maybe we can keep 10 people employed, and trying desperately on every aspect. And everything that we've come up with just isn't working. Business interruption insurance, we've discussed. We've been paying for business interruption insurance since the day we started our business, and we have a clause in our insurance that viruses and pandemics are not covered. So we have no business interruption insurance. And according to our broker, that's most of the policies that are written right now have an exclusion for viruses and pandemics. And so the idea of getting, and I'll take the advice of the gentleman who was here earlier, and we'll go ahead and make a claim, but we've already been informed that we will not be covered for that. So I think it's just really important. I think, we talked about eviction protection, we talked about insurance, we talked about deferment of taxes is another thing. We've been writing letters to state representatives and people at the California Restaurant Association to try and lobby on our behalf. But we need the city. We need to be together as a community. We see our businesses as community connectors. It's why we're in the business of what we do. And our community is hurting, both internally and, on a greater basis. And, there's nowhere it's hurting more than on the front lines with people who are really, really in trouble. We've started a grocery distribution program for our employees who can come in and get whatever groceries we have or we can afford to provide for them. It's like some small gesture, but again, it's just not enough. So I would just implore you to keep the conversation with small business owners, because it's different than when you're really on the front lines and really in the trenches, it's, perfect example is you can't actually go online and apply for unemployment because the system has been taken down. So, these are the real challenges that we as business owners and our employees are facing.
Thank you so much for being here.
Yeah.
Thank you. Julia Mayer, and then Gerard Pepe after her.
Hello, everybody. Thank you for having us. It's so funny because I feel like I went to school during the Thomas Fire on how to handle this, and my husband, who is way more pragmatic and less optimistic than me, said, but during the Thomas Fire, you could look up at the mountain and see how much could burn. And that, I think, is like what you're hearing us all say is we don't really have an idea of how long this could last. We all want to be super proactive, and the problem with being proactive for what we do is proactivity, social distancing, essentially is like it's economic injury for us. And I know that you all understand that, and I absolutely am here to be supportive of you. And what I really think, I keep thinking about is that our city has this incredible opportunity to show awesome and incredible leadership during this unprecedented time. We could come together as local business owners and as city council and as a mayor and absolutely be so strong and unified, because as we heard earlier, 17% of our workforce is hospitality. And if that goes down, we're all gonna go down. We all are so interconnected, nothing's gonna exist without each other. And so what I would really want to say is, first of all, thank you for listening to us. And here, I would love to hear you guys be super unified in your support of us. I obviously understand that the city of Santa Barbara cannot bail out all of us, and I wouldn't expect that at all. I've been in business for 11 years, and we've been incredibly nimble through millions of different oddball scenarios, big and small, and I still have a small business loan from the Thomas Fire. If I have to take out another loan, I will. I have 52 employees. I laid off half of them yesterday. I'm trying my darndest to keep those people here working as much as I can, and I will do that. That means that I'm not making any money, and I'm not asking for anything, right? Here's the realities. But this is my hometown. This is gonna be my kids' hometown. We've already established that. I've said that to you guys many times, but I want to see us survive this, and I think the best way we can survive this is with real clear leadership, really asking the landlords to work with us, and using your voice to apply pressure up the state and down the state. You guys can't get us, I don't expect you guys to give us grants, but what if there was pressure on the state of California from collected city officials that said, this is not going to take our city down, and we need your help with this, or helping us with the insurance commissioners. My policy is 11 years old, and it clearly states no viruses. And, again, I took a risk starting a business. It was just me and my husband, and now we're here. We have 52 people. I'm responsible to them. I recognize that. And, we'll stay open as long as we can. We provide a sense of normalcy, a sense of comfort, and a sense that, we're going to get through it to our community, and I do not take that lightly. I recognize that I have a deep responsibility to the safety of our community. So if we are asked to close, we will. But until that time, I know what my part is to help with you, and I would just ask, whatever I can do, however you want to hear me talk, or whatever I can say, I want to be here to help Santa Barbara get through this. So thank you.
Thank you. Thank you. Mr. Pepe?
Honorable Madam Mayor and the City Council members, I want to thank you and the County of Santa Barbara for helping to feed me, helping to clothe me. The showers of blessings, man, I'm telling you, those are really good showers, and they do put blessings on me. And the churches that help me sleep in the County of Santa Barbara, in the City of Santa Barbara. You know, it amazed me today. This morning, I woke up and I put the news on in my hotel room. I got a hotel. I spent the last of my disability money to get a hotel room at the Alamar just to get out of the rain. I got to watch HBO and stuff like that too, but I watched the news this morning, and not one, Fox 11 News and Channel 3 News, not one mention of the residentially challenged people here in Santa Barbara. Not one mention. And we're the one that's most susceptible to all this stuff you guys were talking about today. I'm shaking like a leaf because, you know, I know you guys don't forget about us when it's giving us tickets by the police for loitering, for eating, for drinking in public, for smoking in public. I got a smoking ticket. I was smoking a pack and a half of non-filtered Camel cigarettes a day for 46 years. Never got a ticket then. Throughout those years, but I get a ticket here in Santa Barbara for smoking. I don't understand that. I really, really don't understand that. So I'm taking a stand. And I went to the Parks and Recreation on Friday. I want to do a free fundraising event at Alameda Park underneath the gazebo. I want to play a little bit of Frank Sinatra, Dean Martin, Sammy Davis Jr., have face painters for the kids, and tables from sponsors on State Street. And all the people just come there to listen to good music. I think it's good music. That's the music I was raised with. Little Frankie, little Dino, you know what I mean? It's like I love music like that. Plus, I have two major bands that are willing to come to Santa Barbara and play and perform that I'm personal friends with. You know, I want to take a stand and do that. I want to get the permits to do it. I want to be able to have my own I'm an Italian from New Jersey, so I want to get my own Italian sausage with onions and bell pepper stand and an Italian meatball stand, meatball sandwich stand. I want to be able to give back to Santa Barbara. You know, thank you guys. Thank you for helping me. I don't know what else to say. I really, really don't. Just, you know, if you pass by somebody that's residentially challenged, give them an apple, give them a rose, give her a rose, give them something. Thank you. Thank you.
Thanks. Michael, did you want to be part of this public comment?
This is for public comment for item number 18, correct, ma'am?
It's number 18, yes.
Oh, did I go out of place? Yes.
No, you did it right, just right.
I did it right. So there. Is this on?
Yes, it is.
Okay.
Go ahead, please.
I have two recommendations during this public safety concern. Number one, I highly recommend that you use your first responding of your fire department instead of having these low-level AMR employees to be responding to it, because a lot of them do not have the capacity to mentally stand there without their own fears getting in the way. And the second recommendation I highly, highly, highly recommend of this council is that you do not put your police department in any danger by decisions that you have made on your own, going against or not with the public health.
Okay, very good, thank you. Anyone else? Okay, we'll close public comment on that. And so what's in front of us is this proclamation. And I'm hearing there might be some support for adding a paragraph where we would reserve the right to ask County Public Health to go further, depending on the circumstances, something like that. But I'm ready. Mr. Gutierrez, your light is on. Are you ready to?
I have a question for.
Oh, question. Okay.
City Attorney Kalan. Here, can you just specify that are we allowing City Administrator Mr. Casey more power than he usually has?
Mr. Kalan?
Madam Mayor, Councilmember Gutierrez, the question was whether this resolution grants Mr. Casey more power than he already has. Once we're 7 days into the emergency, you're in control of it. So yes, you are granting him power to carry out actions during the emergency that we would ordinarily bring you in on. The caveat here, the way we wrote it to make that so that the council is heavily involved, is that each week you'll get a report on the actions that are taken. So it's not as if there would be long delays in reporting to the council on what those actions might be. And I'm talking about, let's imagine that Mr. Casey needs to acquire $35,000 worth of equipment for the fire department. That kind of action needs to happen today. The opportunity's there. You don't want to wait till Tuesday. Those are the kinds of things we were thinking about, as well as executing on orders or recommendations from public health.
So would he have the power to ignore our request?
No.
No, I wouldn't allow that, Mr. Gutierrez.
No, I'm just making sure. Is this a time to make statements?
You have the floor. Go ahead, yeah.
I want to thank everyone who came out today to be heard. I very much appreciate it. I just want to emphasize that, the state has declared or has requested that businesses shut down, non-essential businesses like restaurants and bars, to be able to reduce the rate of outbreak. I personally understand and am fearful of the effects that could cause our local economy and the people that work here and live here. But I think that this situation is probably the most serious one that we've ever faced. And I feel like since the people have given us, have chosen us to represent them and protect them and given us that power, that we need to take it as seriously as possible. I don't feel comfortable always deferring to the county or the state. Our governor didn't defer to the federal government to make the decisions that he's done for our state. I'm just getting wary of us constantly saying, well, we're waiting for the county to tell us what to do. Our residents that chose us to be up here, that's not what they intended us to do. And I feel like we need to do it. We need to acknowledge the history of this city. There's a street called Quarantina Street, and it's called that because at one point in our history, the city quarantined themselves because, ironically enough, ships were coming into our harbor that were infected. And it was such a pivotal part of our history that they named a city so that we wouldn't forget of that situation. And I feel like we're on the verge of doing that. So as drastic as it is, we need to be able to protect our residents. I respect and appreciate the doctor. I don't feel confident that we have enough test kits. I don't feel confident, he stated it, that we have the process set up to go through all those test kits. The best thing we could do is just isolate and shut all unessential businesses down as soon as possible. I'm just imploring all of you to take this as seriously as possible, because we've got 2 cases already, and you have to consider our 101 freeway and the 154 highways. Those are arteries that connect our heart of our community to the rest of the state. So when the counties are shutting down up north, you don't think there's people coming down to leave that situation? You don't think there's people watching to see, okay, which city, which county has the least amount of infected? Like, let's go there. I guarantee you that's happening. So we should do as much as possible to keep us as safe as possible, and we need to just shut all this down.
So you're suggesting retail stores?
All non-essential, yeah.
All non-essential.
Restaurants could become delivery if they choose to. But yeah, I think we've been cautious enough. I rather err on the side of caution when it comes to this situation.
Okay, let's have a discussion then. Ms. Harmon, you're next on the stack, and then Mr. Jordan.
Thank you, Madam Mayor, and thank you very much, Councilmember Gutierrez, for that piece of history. I think that's a really important framing for our discussion today. And I also want to just express my sincere thanks to those of you that came out to give your testimony today about your experience as business owners, as well as the many of you who are no doubt watching who have communicated with us. I mean, those are really, really important words for us to hear, and we're really, for me, hearing the anxiety and the level of care and love you have for your employees and the impacts that the unknown, that what that's having, just really spoke to me. And I know you all were feeling emotional. I was as well. So I really just want to acknowledge your work and thank you. And so there are a couple of things that I would like to see us take action on today. So I'm going to just go through them, and I'll refrain from making a motion out of respect for my colleagues, and we can get to that at the end. But looking forward to your comments. First, with regard to mandating some type of closure on our end here at the city, I will say this was a really difficult issue for me. It's something that I have gone back and forth on because I, too, I share your concerns about the potential economic impacts. But there comes a point, and frankly, a big part of me thinks we've already passed it, where looking at the lessons internationally, nationally, particularly in California, we know that this virus, once it makes its way into our community, and it already has, the degree to which it grows is exponential and inevitable. And I do think that we have a responsibility to be proactive and to take all the steps we can to, quote unquote, flatten the curve, but to delay that inevitability, because that's how we're going to get ahead of it. And I also want to say, from the business side, I'm hearing from all of you that this uncertainty is contributing to a lot of the stress that you're feeling, and that were we to take action to say, look, we are going to mandate that restaurants, bars, breweries, et cetera, are closed, with the exception, I think, of delivery and takeout, for some period of certain time, that might actually go some distance to helping you all feel that we are showing leadership and taking initiative in connection with this virus. And to the extent that taking that action will mitigate the effects of the virus, that is a huge, huge opportunity for us to support you. And I think that must be said. If we take that step, of course, it's important and it shouldn't be done lightly. But any efforts we can make to mitigate the impact of the virus in our community not only is vital for public health, and that is first and foremost our responsibility, but the sooner that we can get rid of this virus, the sooner we can get back to some semblance of normalcy in the city of Santa Barbara. I understand that our authority to take that step is somewhat murky, maybe, but I will say, I've seen other cities of late take the same step, and so I believe if we move forward with a limited closure order, personally, I would like to see something akin to what we saw in the city of Los Angeles and the city of Santa Monica, where they closed restaurants, bars, breweries, nightclubs, except for takeout and delivery, as well as gyms. And places where there was a strong likelihood of close interaction, and do it on a limited time basis. I think until April 6th is reasonable. That's when schools are scheduled, or April 3rd, when schools are scheduled to reopen. I think as an interim measure, that's something that makes sense to me, and is reasonable, and hopefully businesses would understand that this is an effort that we would take to try to mitigate the impacts of the virus. So that's piece one. Thing two, I also heard from the comments today that there is a desire for us to engage with landlords. And what I would suggest and request that my colleagues consider is that we craft a letter to commercial landlords and request that they abate rent to the extent that they are able through the month of April. Certainly, and maybe this is a caveat more generally, this will have to be revisited as we learn more. But I think as an immediate step, that's something that's reasonable, and it's a letter that I would certainly be very happy to sign on to, and I think that it is a step that we should take. Third, the eviction moratorium. I don't know if now is an appropriate time to discuss this.
Yes, ma'am.
Okay, thank you. Well, I think this just goes without saying that it's something that I personally believe is vitally important that we do. We heard about so many hourly employees that had to be let go, and of course, I know that was a very difficult decision, but also that unemployment replaces only a fraction of their pay anyway. You know, rent doesn't stop because you lose your job. And I think in the context in which we are living, it is our responsibility to do what we can to at least just sort of maintain the status quo until we understand what we're dealing with as a result of this virus. And I very much appreciate the governor taking the steps that he did yesterday to allow us to do that. So I would strongly support an eviction moratorium. And for folks that are watching, I've gotten a lot of emails about requiring that landlords don't charge rent. That's really not within our purview, unfortunately. I think that's not what we would be doing here. What we would be doing here is saying that you cannot be evicted during some certain period if you are unable to pay your rent due to circumstances related to the coronavirus. And I think that's the limited capacity in which the governor has allowed and sort of tacitly encouraged cities and municipalities to take this action. And I think, legally speaking, that's what we would be undertaking today. And then in the longer term, working together to figure out ways to help folks who find themselves saddled with back rent because they weren't able to pay their rent during this period. So I will leave it at that. Those are the three things that I'm feeling strongly about, and look forward to my colleagues' comments.
Thank you. Mr. Jordan, please.
Thank you, Madam Mayor. I echo both of the sets of comments I've heard so far. The devil's in the details. I too, isn't the federal government 10 people or less right now? I mean, just the whole disparity between federal guidance, state guidance, what local cities are doing, just further shows me that it's a situation potentially out of control with overlapping agencies who are all giving contradictory information, and it's really unclear who's in charge of what and who's doing what. I mean, what a better situation we could have, right? And further than messing that up is with some of even the concerns you heard in here today. You can't go to one place and see a menu style list of how to solve your problems, whether they're medical, social, employee, insurance, whatever it is. You kind of have to be an expert at something else. So I just as a process point, can't we just adopt this emergency ordinance and then talk about things to do afterwards, or do what we want to do in excess of this need to be put into the emergency ordinance?
Thanks, Mr. Kahlon.
Madam Mayor, Councilmember Jordan, you can approve this resolution and then give us direction on eviction protection, business closures. If you're going to do business closures, it should be in this document.
It should, okay.
Yeah, so the eviction part, my advice would be that you direct us to prepare an ordinance and bring it back as soon as next week.
So I too am in favor of some type of package that protects renters, remedies eviction concerns, and I don't think I heard Ms. Harmon mentioned it, I would like to see that translate to the end of the governor's allowance, which I think was May 31st. And so that I'd be willing to have a discussion on that ordinance and how that's going to look. In terms of meeting spaces, I was looking really quick at my calendar, but if we put it on, we got to take it off, or Paul has to take it off, and you're talking a number of days from the days you did it. I would almost look at that type of action going through April 7th, which would be the next time we're going to meet. That's a Tuesday, and I think April 6th would be the first day back at school, not the 3rd. That's a Friday. So, but I am generally in favor of some definition of a closure of meeting spaces where people come in close contact in and amongst themselves. Doesn't have to involve alcohol, but obviously it would. Doesn't have to involve food, obviously it would. Movie theaters, gyms. I mean, just the list would be predicated by how you defined it and the number of people or the level of close contact. But I said this before, I just think having, I've already, well, I don't know, there's already been too many white shirts in front of me last week and this week. I've told you that. I've used them all up. But having somebody invoke the example of the Bay Area as not being our example, to me, is just the wrong argument. Because to me, the Bay Area got there, or New York got there, or somewhere else got there because they weren't proactive enough. And that our opportunity is to try and be more proactive to avoid getting to where they are, and we had no choice but to do it. And I'm willing to do that. I get that it's just there's a bunch of business models out there that have absolutely no protection from this, and I don't have an answer for it, but I think the longer you wait, the worse it's going to be with those business models than it is now. So wait and hear what the rest of you say, but that's kind of how I'm leaning right now.
Okay, Mr. Friedman, and then Ms. Gutierrez.
Kind of shaking on this one. It's a big decision we're going to make today. So first, I want to thank our business representatives here that came and spoke. Ms. Coonan, I think I got your name right. Ms. Villanueva. I spoke with Ms. Mayer last night. My heart's out with you and your employees. I'm going to give a little different perspective, and I think ultimately I'm going to support what the majority support, because we need to be unified in the message we send to everyone we send it to, from the governor on down. But I need to say some things for the record, and so my family, and I have a different perspective, and I'll tell you why of what I'm hearing from my colleagues. Is my wife works in the ER of Goleta Valley, all different shifts. And so I'm hearing things that from out of there that, I can't repeat them because they're conversations, but I know a lot of what's going on there. I also work at Trader Joe's. I worked there this past weekend, including yesterday. And there's the opportunity to really hear from people and what are people's concerns when you're in that type of setting. And there is fear in our community. Everyone, it's globally. And our primary job is the public health and safety of government, especially local government. But in times like these, it is also just as important that we remain calm and we make decisions to the best of our ability based upon what the experts are telling us, the medical professionals, the scientists, all these websites that are out there, the CDC, the WHO. There's a lot of information, and that information is transforming just as quickly as the virus is going around the globe. But once we start making decisions that aren't calm and based on what the medical and the professionals, it's a very slippery slope because we are reacting more not to what the evidence and the data is, we are reacting to what other areas have done. And at this point right now, before we take this action, and I want to applaud all of our other fellow electeds in the County Board of Supervisors, South Coast City of Carpinteria, City of Goleta, all of their council members, and all our council members in the North County. Because to date, we have all been working through county public health. And the reason that's important is because we can all act based on that same information for the local conditions here. If each of our local governments starts acting independently, it will create confusion for the public. Councilman Oscar Gutierrez mentioned that people from San Francisco are going to come down here. Well, I can guarantee you there will be confusion. An example I'll use is Mission Canyon. If we take an action today to shelter in place or whatever it is, because if we're talking about the measures to prevent it, we also have to talk about shelter in place. There's a lot of things we need to talk about above and beyond this, and we know they're out there, but we're not talking about them today. But if Mission Canyon or other areas that are in one set of rules by the city of Santa Barbara, and literally right across the street from you, you're under a different set of rules because the County Board of Supervisors acts differently, that creates uncertainty within the community. So that's where I'm at is I will support whatever we're supporting because we need to be unified in whatever we're doing, and I said that before. But I think it's a very, very slippery slope for us up here to say we know better than the medical professionals that last 2 weeks have provided this information for us. They're on the front lines. And I'll tell you, working at a grocery store, and I want to tell every grocery store worker out there, you guys are on the front lines too. And the reason I know this is because the public is telling us that. And I feel actually more useful there than I do here. Because I'm there with individuals who work at the store who want to make sure that the public has those resources, the basic resources of food, and we're doing everything we can. We're working longer hours. And when I talk with the public that comes in there, I mean, there's lines to get in now, and we're taking different measures to protect ourselves as workers, but also you, the public. I hear that there is fear and uncertainty, but they don't want an overreaction. And these aren't the people emailing us. These are just, most people are just, we want you to act in our best interest, but we don't want you to overreact. And the thing is, we don't know what an over or underreaction is. So, and there's another thing that I'm going to state this, and pretty much everyone I talk to in person is saying the same thing. They are worried that this could be used, this whole epidemic, as a loss of our civil liberties. And once we start taking away civil liberties, this is the time we need to be most vigilant when you're in a global crisis or a national crisis. Because that is when governments start down the slippery slope of taking away rights. And they're very hard to get back. Very, very hard. We're talking about doing this till April 6th. So I can tell you right now, just being a parent and other things, it's not April 6th. It's most likely the kids are going to be out of school. It's very likely. They could be out of school all the way till September. And we're talking about sheltering in place with kids. Do we have to close our public parks? Because if we can't go to some of these places, or we can't have some place, where are we going to go? Are we going to go to our public parks? Do we have to close them? And the thing is, we need to make those decisions based on our medical experts. So I understand the restaurant, but are we going to close churches today? Serious question. If you're going to say restaurants need to be closed today, do we need to close churches today? We have to have that discussion before we... So that's why I'm nervous. I understand the public health threats. My family, we've already made a plan for what happens, most likely when one of my wife or I get exposed to it. We're probably more high risk than anybody up here, just by the nature of our jobs. And what does that mean? And so I'm very concerned about all these, and I've talked long enough, but I want to know what we're going to do about churches. I want to know what we're going to do about other things today, Because if we're telling people basically stay home, does that mean you can't go outside even for 5 minutes? What does that mean? And if we're going to make the argument that we need to take the maximum efforts to flatten the curve, what does that mean? It's not just closing restaurants. There's a whole lot more that goes into it. And if we start making those decisions based upon what we think now and not based on the evidence and the scientific data and the medical professionals, it's a slippery slope. Last week, I want to remind everyone, we didn't take a certain action, a couple of actions actually. One was we didn't specifically ban the cruise ships, but we had a plan A, which was to request that we send a letter, the mayor sent a letter requesting that they cancel. We had a plan B, which was to work with county public health to declare a public health emergency, and we even had a plan C, which the city attorney had as a backup. It turns out that without us taking the action, they voluntarily are gone. So I've talked long enough. Thank you.
Thank you. Yeah, thank you. Ms. Gutierrez, you're next.
First of all, I want to thank the local businesses owners for coming up. I work at the Franklin Service Center, so when the Thomas fire and the debris flow, I worked very closely with local businesses to help their employers get, financial assistance, food. I understand how crucial it is when the city or the state says, we have to shut down the doors for paperwork reasons just to get financial assistance. It makes a huge difference. I also agree with Oscar. We represent one of the most vulnerable districts, and especially in my district, they're mostly the working class. I do want to support in closing down, bars and wineries, but leaving the restaurants to be able to deliver. I do want to say, Eric, that I do agree that we have to keep calm because that's what we're here for. But at the same time, knowing, I think because we had a plan A and plan B, it helped when situations came forward. So I just wanted to express that I do support being able to close down. So the business owners also have our support when talking to their insurance agencies that this was a city decision.
Very good. Ms. Sneddon.
Thank you, Madam Mayor. I first want to apologize and explain that I do have asthma. I have been to the doctor. It is not COVID, but I do, I think just with everything going on, it's a little bit exacerbated, but just wanted to explain that. And I'll speak while I can. I just don't want to be on the wrong side of this. I think we can learn the lessons from our neighbors who maybe now wished they had acted sooner. And I don't want to be in a position like San Francisco where we're on mandatory sheltering in place and having that to be enforced in any way. And I think if we're a little bit more aggressive on this front end in being able to stave that off, we can ultimately have people's lives saved and also ultimately economic injury minimized if we act quickly and if we act on the front end of that. I also agree that I don't think April, I think the schools are going to continue to be closed. I think, the high school is talking about the rest of the school year, and I think it's pretty optimistic to think April. So with Councilmember Jordan's suggestion that we stay in line with the governor for now, then we're at least in step with that. But I think that restaurants should be closed aside from delivery options. Bars, tasting rooms, I believe should be closed. And again, it's not whether it serves alcohol or not. I suppose it's whether it serves food or not. We are going to need food to be available, to be delivered. We're talking a little bit in districts now. In District 4, we have a large number of elderly people who really already now should be voluntarily sheltering in place. And food delivery service is going to be maybe one way that restaurants can continue to have some employees and have some services and also provide service to the community in in feeding our community. I think there's, if grocery stores or other places are impacted, we're going to need that more and more. It's very difficult to know how to balance all of this in something that is unprecedented, in something that we haven't seen before. And we are the people entrusted with making these decisions. And I think we are taking the information of the county public health officers. We're using that information to make our decisions. We're not saying that the facts are different or that those facts aren't true. We're just possibly using that set of information as well as other organizations' informations and trying to synthesize that into what's best for our city. I want to be really clear that there's no questioning the county public health officials' authority to be sharing these facts with us. I in no way question the facts as presented and the information and the data. I think it's really important that if we make a decision that's different from the county, that it's not seen as alternate facts or universe. It is that we, for our localized city, may just be making different policy decisions based on those same facts, given the population and the density and the particular businesses and what we have in place as different from a county consideration. For that, I think businesses that aren't congregating with more than 5 to 10 people, or 5 people, could stay open. If you are a single business owner going to an office that's your sole office and you're not meeting with other people, I don't see why we would need to limit that. But restaurants, I believe it's time, and I think the county, if they haven't already decided it today in their meeting, it's not far behind. We see that this is the direction that areas are taking. So I'd be in support of restaurants going to delivery option only, restaurants, bars. I think retail also could maybe make a pivot to being a delivery type option. I think that might be a way to stay open. I think it's important to be engaging with the landlords, commercial landlords as well, and not just limiting evictions, but rent increases. I think we have to be careful that there aren't astonishing rent increases right now, just to try and stabilize, if that is something that could be looked at just as an interim measure before the ordinance. I'm not sure about that, but something to look at. Nobody wants to be in this position. I don't want to be in a position to be doing anything against county recommendations, but the county is a very large place. It has North County, it has South County, it has different variable densities of populations in all different places, and I think it is in our purview to look at our city, given the factual information, not contesting that, and synthesizing all the other information available to us through the reputable and stated sites of the World Health Organization, CDC, and the others that we have access to. I think what we can do to flatten the curve is well established, that is proactive protocol, and that's what I would be supportive of.
I haven't made my comments, but I see your light on, Ms. Harmon. Did you have a addendum, or what was your comment?
I was just going to try to sketch out a little more clearly, well, also to respond to Councilmember Friedman. I don't think that we're discussing shelter in place, that they're very, very different concepts. So I just wanted to touch on that. So maybe if you'd like me to go now.
I was going to touch on that if I could. Yes, thank you to everyone who's here today, and Ms. Johnson and I will continue our efforts to help small business. We were hoping Mr. Stensley kind of gave everyone the impression that we are moving in that direction. We want to include you and in it. I like the idea of writing a letter to the commercial property owners, asking them for relief, but also at the same time looking for ways to help them so that they can turn around and help you, if that's how it might work. Our residentially challenged speakers left, But just on that note, we are working on helping our homeless neighbors through the coronavirus challenge. As has been stated, the cruise ships aren't coming. Ms. Johnson and I are talking about how do we ask, pressure, cajole, force, if we can, state and federal authorities to kick us down some financial relief. That's absolutely within our power, the relationships that we have with state and federal representatives, and I think they would like to do that. We are in a crisis, and how can those governments find money to help our people, residents and businesses? We will be increasing our public information and outreach. I'm not criticizing the county. They're posting stuff to their website. People have been asking the city to be more in the public with information, and we've been putting out information on our website. We will be more active with that. I just wanted people to know. And, you know, my suggestion is that we do vote on this proclamation. I want to take a break. I'd like to put up on the screen what Los Angeles Mayor Garcetti did, because it seems to be what we were talking about. It's not locked down, but it's gyms, entertainment locations, restaurants except for takeout, bars, and I read it and it was so well done. And then maybe that would be a place for us to start with the eviction and the rent watch as part of an ordinance. That's going to be a separate motion. But today I was worried because it's St. Patrick's Day, and we're hearing that some of the bars in town were still going to go forward with festivities. And I wanted to ask them, to follow the example of the tasting rooms. You mentioned the expression ethical responsibility. And the doctor sat right there and told us that it's a very contagious virus, and going into a bar and drinking, getting loose, and then are those surfaces clean? As mayor, I ask our bars to close down tonight for St. Patrick's Day. And I ask our residents and other people to, not go to those environments that might endanger all of us. And we do need to pressure our county public health officials and our colleagues at the County Board of Supervisors to listen to what we're saying. So if we take separate votes, Mr. Casey, we could vote on the proclamation now, take a break, and then come back with the Los Angeles. Go ahead. What's your advice?
Madam Mayor, I might suggest that we take a break now, allow us to look at the City of Los Angeles. I also have the California Department of Public Health that provided some really clear guidance that's similar to what you're talking about. Let us work on something, because I think if you're heading down that path, we want to incorporate that into the order. So before you vote on that, we'd like some time to look at that.
I like your advice. You're right. If we're taking a break and looking for resources, let's go ahead and look. Mr. Kahlon, go ahead.
Yes, I hate to be getting in the way of a break, but there are a couple of definitional issues that will help us in the back room while you're working. Mayor Garcetti's order extends to more than just bars, wineries, and food kinds of places.
It's gyms, right?
Correct.
Fitness centers, entertainment.
So, Councilmember Friedman's comment about churches and other kinds of public gatherings is important. Do you want to address all public gathering places, or are you trying to limit this to food and alcohol service?
Go ahead, Ms. Harmon. You have a response.
Thank you. I don't know if should we discuss this now, or should we wait until we come back, I guess is.
Well, I assumed that churches were left off because of constitutional rights, that we wouldn't want to step in that realm. And I haven't heard any other jurisdictions including that. And I was just proposing the Los Angeles edict because it seemed well thought out, and it seemed to reflect what we were saying up here. Go ahead.
And I appreciate you tolerating my interruptions. I'm
That's
trying
okay.
to help you get through this as efficiently as possible. So we started out talking about bars, breweries, the governor, bars, breweries, wineries, nightclubs, restaurants. The Los Angeles order exempts food banks, pharmacies, so does San Francisco, by the way, grocery stores and cafeterias that are located in hospitals and the airport. It does include, though, all entertainment venues. So movie theaters, live entertainment. So this would be an order, if you wish, then that would cover all of those kinds of gathering places, as well as gyms and fitness centers. Okay?
Well, at the minimum, we're concerned about restaurants and bars. I see people nodding.
Well, then, Madam Mayor, during the break, we'll produce a long list, and you can cross off what you don't like.
Okay. Your light's still on, Ms. Harmon? More to say?
Oh, I guess I just really want to, the concept, the churches keeps coming up, and I want to just make the point very clear that I think our interest in taking this step is so that we can avoid getting to the place where we need to shelter in place, close down churches, take really, really sort of militant steps. So I don't think that it's necessary that we have a conversation about closing down churches to look, and I was thinking about the Los Angeles ordinance, Madam Mayor, so that's exactly where my mind was going in my comments. So I just really want to make that clear. We are not talking about saying folks can't gather to worship at this point. I see this effort is one to keep us from having to take that step. I just wanted to really make that clear.
Well, I can tell you that my gym, 24 Hour Fitness, closed yesterday. I think the movie theaters are still open, and we could consider, they have put measures in place. Has anyone read about that? So if we think that they're doing enough caution, then we could take entertainment off of there. So that's something for us to consider. Mr. Friedman, your light's on, and I guess since I still have the floor, I totally understand what you're saying about making decisions that are not medically directed. Thank you.
It's actually, I'm going to clarify because I didn't speak to the evictions. I fully support that and the actions that we're going to be taking, but I also want to make sure that we're looking at, when we craft that ordinance, that we're looking at both commercial and residential. I think it was implied, but I don't know if it was specifically stated, and I know there might be differences in what you can do, but I want to make sure that not only for the businesses, but the employees of those businesses who are going to be facing that at home. So I want to the extent that we can have some protections for both, I want to include that. Thank you.
Let's see if we can get this done in a 10-minute break. We're on recess. We'll call our meeting back to order, please. We are considering what the city of Santa Barbara will do about the coronavirus, how we can contain it, if there's any actions that our city can take. Mr. Casey, I am going to toss it to you.
Okay.
Please.
Yes, Madam Mayor, council members, and then I'll turn it over to the city attorney. We have handed out to you 3 different documents for your perusal to help assist you in making the decision you want to make today. Number 1 is a modified, updated resolution that we had provided to you earlier in the meeting, and that includes Section 9, I believe it is, and 10. Section 9 and 10 have been added to the end of that, and a lot of that language is taken from the City of LA Mayor's order. And so that was just for purposes of conversation. That is what is in the resolution. Does not carry any additional weight than the other documents we're handing out to you. Then we also handed out to you the California Department of Public Health. They provided guidance on retail, food, beverage, and other related service venues, dated March 16th, 2020 is what I have. And that also included some very specific language, especially on page 2. And as we go through that, we can put them up on the overhead projector. And then we just, within the last 2 minutes, received a press release from County Public Health providing guidance on bars, nightclubs, pubs, wineries, and breweries should close immediately, and that restaurants should move to takeout and delivery immediately as well. And so we handed that out to you. That was a 1-page press statement that came out. So those are the resources available to you. We're happy to answer any questions and dialogue and see where you want to go. And Ariel, you want to?
Yeah, let's turn to the screen if we can. Nina has put up Section 10. Let's start with that. That's the easy one. That serves as the factual basis for your action. And this is derived from the statements made by the San Francisco County, City and County of San Francisco's Public Health Department. I believe it to be accurate. I heard nothing from Dr. Fisk today that would contradict the statement in Section 10. So Section 9 is where the rubber meets the road, and Nina can walk you through that.
Section 9, effective immediately and continuing until midnight on April 7th. The following order shall be enforced by the Director of Emergency Services. A, all bars, nightclubs, breweries, wineries, and tasting rooms in the city of Santa Barbara that do not serve food shall be closed to the public. B, any bars, nightclubs, breweries, wineries, or tasting rooms in the city of Santa Barbara that serve food may remain open only for purposes of continuing to prepare and offer food to customers via delivery service or to be picked up. Dine-in food service is prohibited. C, all restaurants and retail food facilities in the city of Santa Barbara shall be prohibited from serving food for consumption on premises. Restaurants and retail food facilities may continue to operate for purposes of preparing and offering food to customers via delivery service to be picked up or for drive-through. For those establishments offering food pickup options, proprietors are directed to establish social distancing practices for those patrons in the queue for pickup. D, the following are exempt from this order: cafeterias, commissaries, and restaurants located within hospitals, nursing homes, or similar facilities. 2, grocery stores. 3, pharmacies. 4, food banks. And 5, Santa Barbara Airport concessionaires. E, all movie theaters, next section, all movie theaters, live performance and entertainment venues, bowling alleys, and arcades shall be closed to the public. All gyms and fitness centers shall be closed to the public.
Okay, well, there's some lights on for questions. That's a good place to start. So Ms. Gutierrez, you wanted to start?
Yes. Where it says under cafeterias or similar facilities, can we just make it clear to add schools cafeterias as well? And also
cafeterias, comma, including school cafeterias?
Yes. Mm-hmm.
Okay. You wanted to ask about, go ahead.
Mayor, if for the sake of our collective efficiency and effectiveness, perhaps you could get consensus on the council on each change as you go through, and that'll help me do the edits in real time. So if you were to ask, for example, whether there was unanimous consent on Councilmember Alejandro Gutierrez.
Is there any objection to specifying school cafeterias? I see no objection, Mr. Kawan.
Thank you, Mayor.
And then my second question is for the city attorney. As a city, can we tell grocery stores if they can have special hours, like the first hour for people that are 65 and older to come into their stores?
Yes.
Mayor, could we add that to?
Okay, let's go ahead and open discussion on that. Oh, Mr. Friedman thinks he has a conflict because he works for a grocery store.
So I need to step out of the room.
Is that accurate, that he should step out?
I can't do the analysis in this kind of time frame. So
I'll voluntarily remove myself if you guys want to discuss that.
Okay, thanks. Don't go far. We've been hearing from the public that they would like to see people over 65 or people with physical disabilities get time in the market. It is pretty crazy in the supermarkets. So I appreciate your suggestion. And Mr. Jordan, your light's on, but I don't think you wanted to talk about something else. Okay. Is there any other opinion? Ms. Harmon?
So I certainly support the idea of having senior hours and folks with differing abilities hours at grocery stores, but to me, there are a couple of questions that I immediately think of. Are we going to be allowing individuals who are, for example, caretakers who aren't seniors to go in with them? There are just a lot of questions that I'm just thinking in this very immediate second about doing that, and my preference, while I'm very supportive of that idea, and maybe we can talk offline about speaking with grocery store owners to get them to comply generally, my preference for this is to really keep it very focused so that it's easy to understand. One of the things we heard from the business owners today is they're just really looking for clear guidance, and my preference is just to keep it as focused as possible, and then maybe offline or at our next meeting we can think through some of these other issues. It's just where I'm at. There's a lot of questions that are coming up for me.
Or maybe like how we're writing a letter urging the commercial property owners to be kind to their tenants, which a lot of them are. We could write a letter. I could write a letter to the supermarket saying, please make accommodation for people who need it. You had a comment on that, Ms. Sneddon?
Yeah, just quickly. I just want to add that I think Gelson's is already doing that voluntarily, and I think it is a good idea to encourage markets to do that, and I'm comfortable with not having it be in this ordinance at this time, or proclamation.
So Ms. Gutierrez, it looks like we'll try a different method rather than putting it in here. Thank you for that, though. Thanks for bringing that up. That is something we hear a lot about. Mr. Jordan, go ahead.
Thank you, Madam Chair. Mr. Clown, just in Section 10, that first line that there's evidence of, sorry, I've already crossed mine out, increasing occurrence. It's kind of like not really what I was arguing about. I was just arguing about being proactive, and I'm just wondering if you can really make that statement, or if a better one would be based on evidence of the increased likelihood of the occurrence.
Councilmember Jordan, the second case in the county was announced today. That's evidence of increasing occurrence.
That's enough for you?
I believe so.
Okay. And then can that paragraph not also reference the DPH and the county's memos that we were handed out today? Because those directly give credence to the action we're taking by saying we should do that?
Sure.
Does that make sense?
It does, and I'm happy to add that if the council trusts me to do that on my own.
Or if you thought it just absolutely doesn't need that, I'm okay too.
I think you're safe enough with this approach. By now, we have the state and the county saying should. That starts to sound like shall.
Okay.
So,
I'm good then. That'll be good. Thank you.
And are we in agreement with that, our council? What Mr. Jordan was just discussing? Okay, so we're okay. Okay. So the question before us then, Mr. Casey, is to look at, go ahead.
And I'll just help frame this a little bit. It seems like there's interest in going this way. So just the distinction, like I mentioned, we handed out 3 different sources of view to be looking at. And the real distinction is that everything up through A through D is very consistent with both the state Department of Public Health and also what the county Department of Public Health just came out. The difference is the city of LA, which we pulled from, includes the movie theaters, live performance. I'm looking at E and F, Nina, if you just move that up a little bit. Yeah. And so the differences is just E and F. Going to movie theaters, live performance, entertainment venues, bowling alleys and arcades shall be closed. All gyms and fitness centers shall be closed to the public. So just drawing the distinction between those resources that I handed out, that's the differences between them.
Then let's have a discussion about that. I know that Ms. Harmon has to excuse herself. Her husband works at a fitness center. So let's go ahead and take movie theaters first and entertainment venues. You know, looking at what the state has said and what the county has just affirmed, I'm willing to take the entertainment piece out. But I want to hear what everybody else has to say. I know that the movie theaters put in place protocol for people sitting and, you know, not too close to each other. They're disinfecting. It's up to us. Do we leave it in or do we take it out? Ms. Sneddon, did you have a comment on that with your light on?
Sorry, Madam Mayor, I actually had a question about farmers markets later.
Okay,
but
we'll hold on that. Mr. Friedman, you have something on entertainment venue?
Given where the county just came in, it gets to my points earlier. I would support until the county public health, again, for the consistency across all jurisdictions. But I will say that if the majority of us want to do that, I will support the majority because I think we need to send a strong message to the public. So I could go either way on this based on my previous comments.
Okay, you could go either way, you're saying. Mr. Gutierrez, an opinion on movie theaters, live performance venues, et cetera?
I would leave it in just because I know that some of the movie theaters are short-staffed as it is. So when it comes to being able to keep them clean, it is a bit of a daunting task. And I think their air system, their air conditioning system, it recirculates the air. So that's another issue. So I will leave them in.
You know, the more conversation that we have about it, I feel like maybe we should check in with the movie theaters, or we're making a decision without. I hadn't heard that about them being short-staffed or questions about their air conditioning system. Other opinions on that? Ms. Gutierrez, your lights on entertainment stuff?
I think we should leave them in.
Leave them in?
Yeah.
Okay. Mr. Jordan, go ahead.
I'd also say leave them in because they seem to be consistent with the paragraphs preceding that. And to me also there's an economic chicken and egg circle there too. As the economic returns on these places you're allowing to stay open deteriorate just because I quit patronizing them, there is no way that they have the resources to clean better than they did when they were economically more healthy. So I just don't think the two I don't think the two accompany each other. You're not going to put 40 employees in there to clean for 10 people coming to see a movie because it needs 40 people to go in there and clean. So
okay.
I think they're in line with the preceding paragraphs.
Okay, so Ms. Sir, go ahead.
Madam Mayor, I don't know whether it is accurate or not, but the council heard testimony that a government-ordered closure might put these businesses in a better position for insurance recovery.
Okay. We're taking a straw poll at this point. Ms. Harmon, I see you thinking.
I share your concern, Madam Mayor, that we haven't heard from movie theater owners. I mean, that is difficult. But a big part of my thinking in moving forward with this, and I think I'm taking the words from Mr. Jordan, is it's about the amount of time that you spend in a place, and that is really a big threshold indicator for whether we need to move forward to protect folks. And you know, you spend a long time in a movie theater, you're not in and out by definition. So for me, I think I would vote to leave it in with the caveat that I would really like to limit the applicability of this order to no later than April 6th or 7th. The LA order is in place until March 31st, and that can be extended. I think that's appropriate, and if we're going to take action that includes affecting businesses that we haven't heard from, I would be more comfortable taking that action if we're going to, by design, have to have another conversation about extending it in 2 weeks. I think that's a reasonable compromise, and it protects us, I think, constitutionally too, quite frankly. So I would vote to keep it in if my colleagues would agree that we would limit the applicability of this order to 2 to 3 weeks, at which point we can come back and have another conversation about how it's working.
I think the date we are working with is April 6th, right? So that's, okay. Okay, then, very good. And we don't have a bowling alley in the city limits. And we don't have an arcade. No, Taffy's has one. But we know that some students went to a concert and contacted someone with the virus. So, Mr. Friedman, did you, or who's left on the straw poll?
I was just going to say the bowling alley is actually in the city of Goleta, so.
It looks like there's a consensus to leave them in. Okay. And now, Ms. Harmon, you can go, because we're going to talk about gyms and fitness. Go ahead, Mr. Kalan.
Madam Mayor, I didn't understand whether we're deleting bowling alleys. I haven't found one yet.
We don't have one in the city limits.
Well, then then it should be removed. We do have an arcade.
Go ahead, Mr. Gutierrez.
Does lawn bowling and bocce ball count? Because we do have a few of those in the city limits.
They're different from bowling alleys, and they're outdoors.
It just says bowling, right?
Indoor bowling, you could say.
The elderly tend to play the lawn bowling the most, so they are the greatest ones at risk.
The question, well, enough people play that it's significant. I think we should leave it as it is. Yeah,
just leave in bowling.
Madam Mayor, Councilmember Gutierrez, the choices are to eliminate bowling altogether, to say indoor, or to say indoor bowling if you're concerned about people who want to recreate outdoors.
I think we should leave it as it is. Go ahead. Go.
Thank you, Madam Mayor. It's a sport that's primarily played by the demographic that's greater at
older
risk.
People.
Yeah, so I think we should be pretty specific.
I agree.
I was thinking they weren't going to go lawn bowling, but if you want to put lawn bowling, I see a couple of people. And you're neutral, Mr. Jordan? Specifying lawn bowling?
Indoor and outdoor bowling.
Indoor and outdoor bowling. Okay. How's that, Mr. Kalan?
I'll just leave bowling. How's that?
Okay. You had something else, Mr. Friedman, on that subject?
Just to clarify, that's a parks facility. Are there any other parks facilities that would have that type of? But you know what? I'm just gonna leave it as it is. It's too much.
Okay.
I'll support. Like I said, I've stated my piece. I'll support.
Yeah, and Madam Mayor, Council members, we're restricting a number of parks activities, so
Okay.
I don't see this being out of step with that.
So are we ready to move on to gyms and fitness centers? Mr. Jordan, your light's on? Okay. Okay, reaching for it. So I said my gym closed. I'm not sure if others are planning. Ms. Sneddon, your opinion?
Does this include, I know, like dance studios, classes, yoga studio, fitness center, gyms, but also, I don't know if that specifically falls under that. Is a dance studio a fitness center?
I didn't think so, but Mr. Kalan is saying yes.
Like, could they choose to have classes with 10 or fewer students for ballet? Or, I'm not saying I think that's a good idea. I'm just wondering how that fits into this definition.
Madam Mayor, Mayor Pro Tem, it really is up to you. I think of a fitness center or a dance center as someplace where people are perspiring and there's bodily fluids. So,
okay, thank you. I'm fine with leaving it as is.
Leaving it as is? Very good. We have agreement on that. Ms. Harmon can come back. So, Mr. Casey, you were comparing what the Los Angeles language and the California public health language. Is it all integrated now? Ms. Sneddon, go ahead.
Thank you, Madam Mayor. In the California Department of Public Health memo, it has a whole section on certified farmers markets. I'm wondering if we need to discuss that here.
Madam Mayor,
I know go ahead.
Council members. So this is guidance that I think the county has also put out guidance on. I'm assuming that you're thinking about whether to include it as guidance as well. I'm not sure that's necessary, so I think it's totally optional, up to you. But unless you were looking to prohibit farmers markets, which I'm not hearing you suggesting.
And I think they've done these things. I've heard that they've suspended sampling. And
so would we assume then that the guidelines for the California Department of Public Health, unless we've said differently in our proclamation, that we would assume they would go with these recommendations? Okay, I'm good with that.
Okay. Ms. Gutierrez?
I'm a little confused.
Okay.
With the whole farmers market, since we are practicing social distance. In farmers market, you still have a large amount of people walking by each other, and even though it says on the state that the booths should be accordingly distanced, but you still have that social interaction. I would suggest to canceling them until that April 3rd. Or if any of my colleagues can give me another suggestion. Because we're trying to, implement social distance, and we've already shut down the libraries and movie theaters and wineries and bars. Farmers market is another place where a lot of people gather.
My response is that it's a source of food and fresh, good produce, and I know they're already following the county suggestions. I get your point, and we can do some research. We could check it out on Saturday or Tuesday and come back on that one if we feel strongly on it. Go ahead, Ms. Harmon.
Thank you, Madam Mayor. I was going to make a similar comment, though I do share your concerns, Councilmember Gutierrez. One thing that I was thinking may be a reasonable compromise in this is to mandate that the booths be some certain distance apart, because I know, I've seen even just today pictures from the recent farmers market where the booths are right next to each other, and I certainly understand that they have to make use of space, but maybe a way that we can influence folks to stay separate and to just do their business and move on is to have some mandated space between the booths? Or is that?
I would suggest that if we want to add something, that we say in our document that our farmers markets have to comply with the state rules and leave it at that.
Madam Mayor, there is a follow-up action to whatever you do today.
What's
and
that?
that will be communicating to the businesses we've shut down this evening. As that communication could include communication to the farmers market that says that the council either insists or encourages them to follow the California Department of Public Health
Guidelines.
and we could enumerate those in a letter.
Okay. We're just trying to have a good relationship with our farmers market, and I'm sensitive to that. You have something on that, Mr. Friedman?
I get the concern, but I consider farmers markets similar to grocery stores due to the food aspect of it. And it is hard to control that in these critical essential services. So, and we haven't heard from the farmers on it. There's a lot of issues going on with that. So I think we could revisit this issue. We can reach out to Mr. Edelman via a letter saying we requesting that you follow the state guidelines, but without them being able to comment on it, on what they're doing, I feel uncomfortable moving forward with anything on the farmers market other than notifying them that we need to do that. So I won't be supporting putting that in there. And again, because I think they're part of the critical food system.
Very good. Ms. Sneddon, something to that?
Thank you, Madam Mayor. I would add my support. Farmers market, critical food source, fresh food, but it's also an outdoor market, so it's actually less communicable than if you were in a closed market. So I think they'll eventually want to be moving towards maybe curbside delivery out to cars or different ideas that they can do. But I'm comfortable with the state guidance, and I don't feel the will to mandate the market have more hardship on being able to deliver food.
And it is something we can revisit later with their coordination. So your light is on, Ms. Gutierrez and Mr. Jordan. You have another subject or on that subject?
Just
Oh,
wait.
that subject.
So
okay.
I just will say I agree with that too. It's a prep food source, and most important, I have the opportunity to walk where I want to walk at farmers market. Most of the other things above that, by nature, they put me close to other people. If I'm feeling uncomfortable personally at how close I am at farmers market, I can just go get out of the way, wait till the crowd's gone, and then move in. So I think that's important.
Go ahead, Ms. Gutierrez.
I would really like what the state has, and if we can somewhat implement it to what we have, I will feel comfortable.
Okay.
Yeah.
On the farmers market?
On the farmers market, on the guidelines that the state has. for
Okay.
them.
Okay. I think we've gone through all the points. Ms. Johnson, you're over there in charge of the actual document. Well, we have it here, right? So this is what we're looking at with the changes we've just made. Are we ready to vote on that? And then we still need to vote on the proclamation, and then we need to bring back tenants' issues.
Madam Mayor, the proclamation is included in what you're looking at. We added these provisions to the proclamation,
this
so
is
it's
the
all one
okay.
document.
Thank you. Sorry. I kept thinking 1, 2, 3.
Well, it's confusing. It's two documents. It's a resolution covering the proclamation that Mr. Casey did yesterday.
Understood. Ms. Harmon, to that point?
Thank
or
you.
something else?
I just have one more quick question.
Okay.
The LA resolution includes a provision for violations. Do we need to do that in here, or is that inherent in our action?
I preferred not to do it, Councilmember Harmon. Instead, I included an order for the Director of Emergency Services to enforce it.
Great.
And I believe that'll be sufficient for Mr. Casey to activate the police and possibly even sheriffs in coordination with the county if need be.
Perfect. Just wanted to make sure it was enforceable.
Thanks. Your light's on, Ms. Gutierrez? Is it just on from last time? Okay. So what would a good motion sound like, Mr. Kalan, to put forward this resolution?
Mm-hmm.
Okay. Do I have a motion? Second. So that was Harmon, Sneddon, with a comment?
So for the recusals, can they still vote? Does it put this in jeopardy at all? I want to make sure.
No, thank you for the question, Councilman Mayor Pro Tem. The council has already voted on the two issues where there were recusals. Those council members can now come in and vote on the remaining action.
Thank you.
Their votes will be recorded as abstention for conflict of interest on those two subsidiary motions.
Thank you.
Okay, so let's go ahead and take a roll call vote for the formality of it. And good work, everyone. Very proud of us. Thank you. Ms. Clerk.
Councilmember Jordan.
Yes.
Councilmember Alejandro Gutierrez.
Yes.
Mayor Pro Tem Sneddon.
Yes.
Councilmember Friedman.
Yes.
Councilmember Harmon.
Yes.
Councilmember Oscar Gutierrez.
Aye.
And Mayor Murillo.
Aye. That was unanimous. Thank you, everyone, for working on that. Mr. Casey?
Before I continue, I believe you wanted to talk about evictions and any direction you might want to give us on that.
Right. So the governor, can we go off of what the governor said? And I think it was just yesterday, right? Okay. And I don't have that in front of me.
Madam Mayor, I can summarize
please.
the
Yeah, thank
issues
you.
if that might help.
I just don't have it.
So, number one, the governor's executive order authorizes, it suspends preemption of the noticing provisions in the Civil Code for both residential and commercial tenancies. You can infer from that that the governor wants to empower cities to take care of businesses who have this problem as well as residential tenants. The second thing that the governor's executive order does that is notable in light of San Francisco and Santa Monica is limit the period of time to May 31, 2020. San Francisco and Santa Monica have said that tenants need not pay rent until the end of the emergency, and at that point they need to pay it back within 6 months. So the issues you'd need to decide other than May 31, which I think we have fixed, would be a repayment period and whether you want to include a commercial, residential, or both. I would note that Hermosa Beach, for example, only did commercial eviction protection, not residential. Other cities have done just residential.
Ms. Sneddon, go ahead.
Thank you, Madam Mayor. I just want to make the motion, or if it's not time for that yet, just express my support for this. I'm looking at the executive order here, and it seems to apply to us. And if we have the authority to be able to do that, I'd like to be able to do that until the May 31st.
And the questions we needed to ask were residential only or commercial only or both, Mr. Cohen?
Yes, and then the payback period for rents that the tenant doesn't pay between now and May 31.
What does the executive order say about paying back the rent?
It's silent.
Oh, it's silent.
Yeah, what I was saying, San Francisco and Santa Monica went 6 months on the payback period. San Jose directed their attorney to prepare an ordinance. It's out there now. It wasn't as of last week. The others acted by executive order. Again, I strongly recommend you act by ordinance on this.
Act by ordinance, and we should consider a 6-month payback period. That seems reasonable. Ms. Harmon?
Thank you, Madam Mayor. I just have a couple of questions to clarify. So how I understand the executive order, and I may very well be wrong about this, but my understanding is that the governor's order specifically says that you cannot move to evict a tenant who is unable to pay due to circumstances related to COVID-19. The order doesn't relate to, I don't see the order necessarily as saying you don't have to pay during this period. Are we allowed to say that?
They are saying that.
They are,
if
okay.
the reason for non-payment is COVID.
I see. Okay, so it's just a different phrasing, I guess?
No, I'm trying to say
Okay.
the same thing you are.
Okay.
All of the orders have limited their application to situations where the non-payment of rent is the direct result of COVID.
I think I understand.
Either losing a job or being ill or needing to care for a loved one. Those are fleshed out pretty well in the Santa Monica version. And that, in an ordinance I'll bring back to you next week if you wish, we would flesh out those details so you can make some choices.
Thank you. That I was misunderstanding. I really appreciate that. Personally, I would like to see as long as is reasonable to repay that rent. I think just because the crisis ends doesn't mean that people are going to all of a sudden have access to large pools of money to pay back rent. And I think we could be getting ourselves into a situation here where once the crisis is over, folks are saddled with debt that they are unable to pay, thus sort of recreating this cycle. We're just pushing it out. And I certainly want to do everything we can to keep people in their homes during the crisis. That is sort of a foundational step one that has to be done. But to the extent that we can find a basis to extend that payback period to a year, personally, I'm inclined toward that. A lot of the people that will be making use of this protection are hourly workers, low wage employees, and not folks who are going to be easily able to make up a month or a month and a half's worth of rent in 6 months. So that's just sort of my inclination. If 6 months is the only thing we have a reasonable basis for, I would support that. But as long as possible is where my heart is, and on commercial and residential for me.
Mr. Friedman, your light's on to this subject?
Thank you, Madam Mayor. One of the questions I have, though, is there not, I don't know who to address this to, or it's just something I want to raise, and I guess we could talk about it, I guess, next week, is there are some landlords who have bought their buildings, or there are some smaller landlords, and their bank isn't, they have to make their payments. And so there's an unintended consequence that just comes to my mind right now is how is that going to impact if all of a sudden they're defaulting on their loans and they could end up losing their property? Then the business is out, the tenant might be out. I want to understand those implications before I take a vote on that. I want to help renters, both commercial and residential, through this to the extent that we can, but I don't want to take an action that could result in everybody, landlords and tenants, both commercial and residential, actually being worse off because of bank loans. And maybe that's going to be addressed in the coming weeks through some federal legislation, which it could be. But to the extent we can talk about that next week before we vote, I want to understand as much information on that potential unintended consequence.
I can give you this now. The governor's order also includes a request of financial institutions not to foreclose on landlords.
Then can we send a letter to our congressional delegation to take that action yesterday if we can, or as soon as we can, to resolve that issue? Just send a letter from the city on that.
Right, and this is coming back, so we don't have to decide everything. These are the questions that we're asking. Ms. Snedden, to this topic?
To this topic, thank you, Madam Mayor. So on the other side of that, I know we've done a lot of work with leases, but so here's a scenario. I'll just personalize it. It's my daughter, and it's in Denver, so it's not here. She came home. She knows she's not going back to her apartment in Denver, but she is in a lease and is going to have to pay rent for the next 6 months. And that's another flip side. If somebody knows their economic situation is going to change, that they're not going to be able to repay that no matter how many months they have to repay it, but they're caught in a lease, is there any guidance or anything we can do for that? Or maybe that can the owner then release them from the lease if it's mutually agreed upon, but then they would never get any return? I don't know.
So I am licensed in Colorado, and I still own property there. The landlord in Colorado has a duty to mitigate her damages, meaning has to make efforts to release the property as soon as possible. So generally a tenant is protected in a tight market if they have a lease, because even if they terminate early, the market is such that they're not likely to face the full default period as the damages. The landlord's likely to be able to release it at a comparable price fairly quickly. So that's kind of an upper division problem.
Is that true here?
It is true here.
We have a tight rental market.
It is true
if
here.
someone knew that their finances would not allow them, when they see the future now and I'm not ever going to be able to pay this rent again for a long time, they can work it out with their landlord to be released.
Yes, in the first instance, a person in that situation should attempt to find a replacement tenant to the liking of the landlord.
Thank you.
Ms. Gutierrez?
I would just like to say that I would like to also add the commercial and residents.
Very good. Mr. Jordan?
Thank you, Madam Mayor. Mr. Colon, either I didn't hear or I didn't follow the answer to Mr. Friedman. So a local ordinance would affect a local landlord and a local tenant. A local ordinance, if that landlord defaulted on his loan to a national lender and that lender foreclosed and evicted, this would do nothing for that tenant, correct?
That's correct.
Okay. So I have the same concerns. You're just, I guess, presumptively passing the burden up to somebody presumptively that you feel can bear it. And I don't know that that's true in every case. It's certainly true in maybe more cases than not, but somebody's going to get hurt in this too, and I don't really know the answer. I'm fully in support of crafting something local to protect local tenants, but I'm concerned about nothing being done to protect local owners who would have the immediate cash flow problem of being able to service a loan and fall into the same problem we're attempting to fix with their tenant. So.
But if the tenant doesn't have the money to pay, there is nothing coming. So, so let's work on backfilling that, pressuring or working with our state or federal representatives. How can they help in that situation?
And the other note I wrote, whether it was I was reading and writing, somebody sent me something from the city of Sacramento. The expiration period of an ordinance, would that be tied to a period of time after the local health emergency expired? Was that mentioned?
No, Governor Newsom's protections extend through May 31. I want to clarify something I said. The foreclosure protection is in the executive order, and it says that the judicial foreclosure action is not available when a local government has imposed the eviction limitation. So I want to correct myself. The governor's executive order protects the owners from the non-payment of rent consequences.
And a state law is applicable to a national lender then, right? Or a state executive order?
It should be under these circumstances,
Right.
yeah.
And so then my other concern was, I guess, we had this conversation maybe a little earlier, Mr. Colon, on what the governor opened, asking us to step over the threshold and just putting that date on it. To me, that date is meaninglessly too close to right now, that there's nobody who's going to recover or not need assistance after that date. And so are we, with his executive order, are we also able to craft a local ordinance that more mirrors the declaration of local emergency timeline and then give a payback period, or is that overstepping our authority?
It's within your authority, Councilmember Jordan. I want to remind the council that you have already directed me to prepare a just cause ordinance that mirrors AB 1482, That ordinance is waiting Kaiser Marston's work on the relocation assistance nexus study, which is due to me this week, barring any disease, flood, fire, or other disaster.
It's already here.
Okay, but specifically, there's no, so the pros, I get the pros. There's no con to us saying that our ordinance would not mirror the timeline of the government's executive order, but our ordinance would, it's specifically to payback period or applicability of not paying the rent. It would mirror the local declaration of a health emergency, and then when that is stopped, then your payback period would start?
That's what the models out there have done. I would be concerned, I am somewhat concerned about the 6-month payback period. As you are mentioning, the length of the emergency is unknown at this point. As the payback period extends, the loss in the use of money for the property owner increases. In the rent-controlled environments where these rules have been put in place, San Francisco, Santa Monica, the property owner has a vehicle to come back to the city or the rent control board and say, wait a minute, I lost money because of coronavirus. I need to be able to increase my rents to cover it. So in a place like Santa Monica with rent control, they have a built-in mechanism of recouping the loss here. In a market rate environment like Santa Barbara, we don't quite have that easy a mechanism for someone who is renting a unit, presumably at market, to recover the losses during this period. So the prudent thing to do is to, as the governor suggested, keep the initial emergency period relatively brief. May 31 gives us about 3 months from today. And then I would caution you about a payback period. 6 months seems to be trendy out there. Use your own judgment about whether that's too long or too short. Obviously, the longer the payback period, the less likely it is to get paid back.
And so under that scenario, if the situation continued on past that month, we would hope that the governor would amend his language to another time period, and then you would just ask us if we wanted to amend the ordinance to match that.
Right, presuming you had money to pay any of us at that point.
Yeah, okay.
Because if this emergency lasts that long, we're talking about economic dislocation that will overwhelm these issues.
Okay, all right, thank you.
Okay, so we're considering our ordinance going through May 31st and a 6-month period to pay it back. And I think that's what's on the table. Ms. Harmon, your light's on?
Thank you, Madam Mayor. Just a question for Mr. Colon. You teed it up so well. Is this an appropriate avenue or moment for us to consider during this period between now and May 31st to limiting rent increases? I mean, is that sort of a twin of this action that we should talk about next week, or is that a step too far? It's something I'm personally interested in your legal perspective about whether we have that capacity.
I honestly don't have a strictly legal perspective on it, but the idea of people being unable to pay rent and rents increasing at the same time seems inconsistent.
So you're saying we could limit
You could,
that.
but I question whether the market forces are there to drive rents when there's no money in the economy.
Okay, I'm glad you asked that question. Ms. Gutierrez, did you have a okay. Okay, so do you think you have clear enough direction to go and come back with an ordinance?
I do. Thank you.
Okay. And then the question is, when will it come back? So we had canceled our meetings. One for spring break this next week, and then the week after that is the Cesar Chavez birthday holiday.
Could I ask another question before you go there? I'm sorry.
Oh, please go ahead.
I toggled on and off.
Okay.
Mr. Cullen, so could you tell me, so we're in March. So April, just forgive me, April 1st, I can't pay my rent. The agreement down there was 120 days? Is that where everybody was leaning? Okay. So do I have 120 days from April 1st to pay it back, or 120 days after 5/31?
180 after 5/31 is
That's
what I
meant.
heard from the council.
And any subsequent months after that also?
The way I read the governor's executive order, you will not be empowered to excuse non-payment after May 31.
No, but so
So
then I
not
miss May also. So I have 2 months worth of accumulated unpaid rent. My payment due date starts 120 days, is 120 days for both of those months after 5/31.
Right.
That's the way, okay, thank
Right,
you.
and then it's unclear from there what I think happens. If you miss the June rent, you get a 3-day notice to quit, but you still have 6 months to pay off the May and April rent.
That's why I kind of like the local emergency thing, but that's a whole nother ball of monkeys, huh?
Thank you. Mr. Friedman?
Just want to clarify what I heard there. Prior to May 31st, you have 2 months rent that you're behind on. So come May 31st, those 2 months are due 6 months later, or is one of them due 7 months later? Like, would the May due 7 months later? That's, I think, what Mike was asking. So they're both due 6 months later, combined?
Yes,
Okay.
the total has to be paid no later than 6 months after the conclusion of the emergency.
Okay, thank you. That clarifies it for me. Thank you.
Your light's still on? Okay, he's done though. So let's have a motion to send that to our legal counsel for return. So, Mr. Casey.
Yeah.
Okay, so who was the maker of the motion? So it was Sned and Harmon, first and seconder, Ms. Clerk?
And then I'm going to look across at Mr. Kalan, who has been saying he needs a week. And so my suggestion would be, if he can make it, is that we just schedule a meeting next Tuesday at 2 p.m., your regularly scheduled time, and bring that back as a special meeting at that point.
Did anyone make plans thinking that our meeting was canceled next week?
Yes.
So then to bring it back next Tuesday, if you can do it, let us know. If you
I
can't do
it.
it,
No,
okay,
I
you
can
can't
do
do
it
it.
easily, no problem.
Okay. If we're ready to vote, all in favor?
Aye.
Aye. Any opposed? Okay. So that one's done. We'd still like to hear from our library services director, and she's been
Yes.
here all afternoon.
Thank her for waiting all afternoon. So I have a few slides to go through.
Okay,
because I think it's
please.
important to communicate how city services are being impacted and what we're doing to try to address our ability to help the community out. And so we got a few slides, and Nina's going to help me out here. First off, again, we want to drive people to publichealthsbc.org. That is the county public health website. That still is the best kind of single point of shopping for good information. It certainly is all moving very quickly, as just this afternoon has shown. And so just need to continue to pay attention. It's also in Spanish to be available and accessible there as well. We are working on our website as well to put as much information on ours. And one of the key things we're going to be pushing out is how to access city services with the online services that we already have in place. And so you'll see that as a theme as we walk through here. We'll continue to update our website with information in that regard. So, some service updates. We are certainly enhancing our cleaning on a daily basis in all city facilities, and our facility staff is doing that. City offices will continue to be staffed. We are assisting employees, though, who need to self-isolate, take care of children or sick family members, and we've issued guidance about that, and we've issued guidance about what pay sources they could use to take off. I think we have it further, but I'll just mention here, we are providing 2 weeks of paid sick leave time with an emergency code so that people, if they do not feel well, go and stay home. Our hourly employees or new employees don't always have a lot of accrued sick leave time or other time off, and we don't want that to be an impediment to them taking care of themselves and, quite honestly, taking care of their coworkers as well. And so we are stepping up and providing that. We're going to be holding virtual meetings and using telecommuting technology where possible and where needed. We're a large, diverse organization, 1,500 employees, a lot of different operations. Some are well suited towards telecommuting, and so our IT folks have been working with staff to set them up to be able to do so, and we're encouraging that. There are other jobs, though, within our complex organization that do require people to be on site, so we're maximizing that as best we can. Just official announcement, cruise ships have been canceled through June, so that issue is off the table. It seems like a long time ago. Last week we were talking about that. Santa Barbara Airport flights continue to operate, but the airline industry is really struggling. The amount of passengers are just a fraction of capacity. We are fully expecting the airlines to retrench the amount of service, not only to Santa Barbara, but nationwide and internationally, as you've seen. But we continue to do the enhanced cleaning and routine implementation of that. The FAA did reach out to us and instruct that we are part of a national transportation network and that we cannot close the airport at the local level, even if we wanted to. So we must remain open. But I think you will see a substantial reduction in service in the airport in the month to come. So, update on this, we had a 2-week break scheduled, but we will meet next week. For now, we will not meet on Cesar Chavez holiday on March 31st, but let's see where we're at and where we're going. We would like a little pause so we can work on the technology about how we're going to conduct our meetings going forward. We want to work on the ability of you all to be able to phone in some way and still participate. We think that will be relatively easy. The harder part will be how we manage public comment live in person. There are legal issues we have to be considered about. It's not as easy as people sitting home at the couch and being able to call in. There's other considerations we have to figure out. City of Los Angeles, as an example, has set up a tent outside of City Hall to wire and facilitate public comment that way. So we've got some logistics to work out, but we are trying to figure that out. Go back one, Nina, sorry. Most board and commission meetings are canceled through the end of March. And so that's part of what the emergency declaration gave me the authority to do. And we're doing that unless necessary by law. I mention that because the state has not waived the Permit Streamlining Act requirements on us yet. And so we are by law still required to process land development applications in a timely manner. So that impacts your Architectural Board of Review, Historic Landmarks Commission, Single Family Design Board, and in some instances, the Planning Commission. We are canceling those in the next 2 weeks so that we can work again on the technology so that your volunteers can participate in home. We have a number that hit the age criteria where they should be self-isolating, and so it's not appropriate for them to come into the room. But if they can participate from home, then we can keep a quorum and still be moving forward. And then the same complexity of figuring out how people can public comment in person, we have to figure out as well, while maintaining crowd control within the rooms and not exceed any thresholds that we think are not safe. Several parks and recreation facilities are closed through April 6th at this point. Los Baños Pool, Carrillo Gym, Carrillo Rec Center, and the Municipal Tennis Center. City parks and restrooms will remain open during normal peak hours. I think just observing what the guidance has been from the public health professionals, they still want people to get outside, get fresh air and exercise, but they want you to do it within that social distancing standpoint, and so parks are available to that. The Santa Barbara Golf Club will still be open, but will use social distancing parameters as well. Outdoor organized sports and spring break camps and beach volleyball classes are canceled. The community centers, however, will continue to serve as sites for food distribution and brown bag pickup programs only. There will be no drop-in programming, and so that affects our community centers throughout the city. Ms. Caliente will talk more, but all of our libraries, as you know, have been temporarily closed with the tentative reopening date of April 6th. We're kind of tracking the school and what they will do in that regard. Many family programs are available online, and I want to finish with what they're doing because at this time, a lot of families are home, and they're struggling with how to keep kids entertained and educated and learning. And so the creative staff at the library are coming up with some options for that. we have gone ahead and canceled street sweeping in the residential neighborhoods. We heard that from a number of you as a suggestion, which I think we were hearing from the community, that if people are self-isolating and home with the schools, they don't want to have to worry about going out and moving the car. And so we have gone ahead in the residential neighborhoods to cancel those street sweeping and parking enforcement through March. We are keeping the parking enforcement downtown in the commercial corridor. That enforcement is really to benefit businesses, to keep the curbside 75-minute free available for their customers, so that there's turnover and easy access to the shops. And so at this point, we are maintaining the commercial enforcement of those time limits, but we'll keep evaluating that on a daily basis as well. Public counters. So all of our public counters we are going to close within the city to limit contact and congregated areas. Each of the department has been looking at their counter and how they can continue to provide service. And so the message is we still will be providing services. We're just going to provide them in different ways. We are going to have staff available, answer phone calls, to answer emails. We'll also have drop-off bins or centers for things that require drop-off. This is consistent with what every city in the county is doing. I've been coordinating with the city managers on that. And so we're kind of in step with taking these procedures, A, to protect the public, to protect our customers, and also protect our staff in working those public counters. And so, but there will be great emphasis to continue to provide the services that those counters provide. And then finally, before I turn it over to Ms. Caliente, as you heard from the small businesses owners today, this is unlike any economic impact I think we've ever seen. This is different than the Thomas Fire and the debris flow. This is different than an economic recession. This is kind of a halt to so much economic activity. They feel it first. They are on the front lines. And so I feel for them, and I feel their pain. We feel it in a little bit of a lag, but I think we are going to be dramatically impacted from a city budget and financial standpoint. Our transient occupancy tax, I think, is going to be severely limited over the upcoming months. Sales tax is going to be severely limited. Our department fees and revenues, as we cancel all these programmings and activities and rentals and stuff, will be completely devastated. So a super big challenge, because at the same time we are an essential government facility with essential services that we need to provide in this time of crisis, and so we'll continue to do so. We have surplus revenues to help in a situation like this. It's 25% of our operating budget, so that's about 3 months worth of revenue that we have on hand to get us through very troubling times like this. But I think this could be the most serious financial impact the city has faced, even greater than the recession of the late 2000s. And so we're going to start taking steps to try to address that as well. And it will be a challenge. So it's a challenge because we're still working on the disaster, but at the same time having to look just a few months down the road about how we're going to manage this. So I just kind of lay that out there. It's just kind of on our item number 10 on our front burner of things to be thinking about. I will say that the state and federal governments seem to be aggressive in providing assistance to the economy as a whole, to the consumer, and possibly to local governments. We shall see. I spoke with Congressman Carbajal by phone last night, and he expressed a desire, not only with all the other efforts that Congress has passed so far. He had a great 4-point plan of things they've already taken care of passing legislation that's pending in the Senate and stuff like that. But he also said kind of the next step of how to assist local businesses, important industries, but he wants to include local government in that. And I really appreciate that because, again, we are a service providing entity. Over half our budget is police and fire, and we want to continue to maintain those essential public services. So having financial support to get through this would be very helpful. So we'll continue to work with his office, and he expressed his desire and commitment to do so. We'll talk about this more, but we are in the middle of finalizing our recommended budget. It's going to be a strange budget year because we've just spent the last 5 months putting together a budget under different times. And I think it's going to have to be moving forward with a budget document that doesn't really reflect the reality, and then we have to work in real time to be adjusting to the economic climate that we're facing in. But we'll have plenty of opportunity to talk about that more down the road. If there are any questions about city services, we will be getting this information out to the public as well. The public counter closures will start tomorrow, and we'll get that information out to our customers.
So our meeting next week will look like this?
I think for next week, we will see if there's any technological implementation we can do in the meantime. Again, it's easier for you all to be able to call in, and so if there's an interest in that, talk to me and we can see about setting that up. I don't know if we'll have figured out how to deal with the public comment portion,
part.
And setting up something remotely. So I don't want to promise, because I haven't met with the staff to talk about that. But if you have an interest on calling in, I think the governor's declarations and such has made that easier to do. And so we're happy to work with you and make that happen.
Ms. Sneddon and then Mr. Friedman, question?
Thank you, Madam Mayor. I don't have a question so much as just an appreciation. I think it's been, you're doing the lion's share of the work here and getting everything in order internally in City Hall. And I think working on the public outreach and how we're communicating that out has been difficult also, but we should see that being more forthcoming now that the immediate crisis internally in the city and taking care of our employees and staff, and just thanking you for that and hoping that morale can stay high and that people feel safe and looked after and that they're able to stay home when they need to. So
yeah, thank you, Madam Mayor. I do really want to, I do it often, but just recognize city staff. You have outstanding city staff who are really dedicated public servants. Your police and firefighters are out there kind of on the front lines with the uncertainty of their interactions on a daily basis. The water and wastewater folks, as I've mentioned before, are coming up with contingency planning to make sure that that critical infrastructure is needed. And then really everyone in all the other departments are support to those folks as well. And so they're essential. And so as I mentioned to staff frequently, when an emergency hits, you're no longer a city employee, you're an emergency services employee. And so you put on a different hat. And they show up to work and they say what we can do. I will say that the public counter issue will be very well received by staff. There is anxiety, as we all understand, about that direct connection. And so we will be very diligent about providing the services, but in a different way. And so I think that'll go a long way. And then quite frankly, with us stepping up with the notice about paid time off, if you are either sick or you have to care for someone, I think was a good practice for us to be able to implement as well.
Mr. Friedman?
Thank you, Mr. Casey, and thank you to all of our staff. Just a question, because we're getting an update now from you on if we can, as part of our agendas from basically here on out, if we can put a standing item just on coronavirus update, whether it's just from you, if there is a time where we need to have public health back, but if we can just, starting next week, if we could have that as basically every week have that on the agenda, it would be helpful for all of us in the public. So thank you.
Was our library director going to have?
Yes, so now I want to end on a creative, positive note about the great programming that the library is able to bring forward.
See, good practices. She's wiping off the keyboard.
Good evening, Madam Mayor and City Council. Thanks for having me today. So I first want to thank Mr. Casey for supporting the closure of the library. We closed end of business on Friday. We were one of the first public libraries to close, and so I really thank him for supporting that, as well as for the options for our hourly staff to have the paid time off. Many of my colleagues throughout California are just sending hourly folks home, and so thank you. Now on to the library services. So during the Thomas Fire and subsequent mud flow, the library really behaved as a sanctuary. We had thousands of people coming in through our doors to either find clean air or something to do with the families. And now that we have literally tens of thousands of students at home in our community, the library is trying to find creative ways to serve everyone. I just want to start off by reminding everyone about the services that we have for free with your library card. Of course, we have hundreds of thousands of audiobooks and ebooks at your disposal to download from our online catalog, as well as other digital resources. Perhaps you've finished all of your Netflix binging and need to move on to some educational material. Canopy is a great resource for families. There are a lot of very quality children's programs on Canopy, as well as for adults. There's the entire Criterion collection. And then for news and magazines, whether or not you are into Motor Trend or The New Yorker, you can find all of those magazines online. And then, of course, information in real time is very important. So with your library card, you have free access every single day to the New York Times, the full the full newspaper. And then perhaps while you're sitting at home, you want to grow your brain and learn something new. So whether or not you want to tackle that pivot table in Excel or learn some leadership skills, lynda.com or LinkedIn Learning is available for free with your library card. Many of us have students at home that are in language classes at school. Mango Languages is a great complement to that. They can go online and work with their teachers or other learning classes to go through those modules to help support that education. And then I want to mention our Inky resources. That's another online resource that has a lot of online test prep. So I know I have a son at home who's supposed to be preparing for AP exams, SAT exams, so you can go online for free with your library card and download all of these books. So we are also trying to establish some programming that can happen virtually. So tomorrow we'll be doing our first live in real time early literacy class at 10:30 a.m. And then we'll also have another one on Thursday. We're also creating a lot of content that is evergreen that will go on our Facebook and YouTube channels, both in English and Spanish. And then we're also going to be live streaming some of our adult programs that were already scheduled. So the Trails Talk will go on and Santa Barbara Music Club will go on virtually. And then book bundles and kits for kids. So because we were not able to give a lot of notice to the public, there was no dash and grab at the library. And so we've had a lot of interest in how can I get actual materials for my kids. And so by appointment, we sent out a survey to our library patrons just today, and within the first hour received hundreds of requests for these book bundles. So it's for youth only right now, but essentially they fill out a survey for what they need in the developmental stage of their children, and then the librarian is curating that content. So a lot of these resources are available with a library card, but don't worry if you don't have one because you can get one online. You do not need to visit any of our branches and just go to sbplibrary.org/library card. And I want to encourage everyone to visit the library's website because there's a lot of curated data for educational resources. So if you're curious and wondering what really I should be pushing my kids towards, our librarians have a lot of resources for your children as well as for you if you're an adult and you just don't know what to read or what to look for in those hundreds of thousands of books available to you online. And then contacting us, you can call us, you can chat with us, you can text us, and you can email us. And I will say that our phone systems at the library have multiple people staffing them every day, both English and Spanish speakers. And so that's one of the biggest services we're actually providing is our community is calling the library quite a lot to just figure out what to do, what city resources are. So if you need to send folks to get information to the library, that's what we're here for.
Question from Ms. Harmon or comment?
Thank you, Madam Mayor. No, I just wanted to express my appreciation for all that you've done. I know, you got kind of panicked late night emails from me this weekend being like, what about this? What are we doing about this? And you're so 20 steps ahead of me. It's not even funny. And I'm so, so grateful. And I know in my circle, we're kind of passing around the joke memes that are like, schedule, 10 o'clock, watch TV, 11 o'clock, show more TV, 12 o'clock, eat while watching TV. And these resources are going to allow us to be creative with our children and to really make the most of this difficult time and to engage with one another in a way that hopefully we're doing all the time, but for those of us that work, we don't always have the opportunity to really dig in. So thank you. Just thank you so much.
I don't see any other lights. Thank you so much, Ms. Caliente. I'm hearkening back to that Friday when we made the difficult decision to close the physical library space. And, for members of the public, this is what we've been dealing with for the last few weeks. And it's difficult. Chief, thank you so much. I talked to a firefighter today, and he was so calm because we've been through fire, the debris flow, and he was like, we're whatever's coming at us, we can handle it. So I'd just like to pass that on to the public that the decisions we made today were difficult. We're still trying to be a responsive city, and we're happy to get your emails and try to answer them as well as we can, and your phone calls. So I had a quick question for Mr. Kahlon about the actions we took today. When will those go into effect? and then Mr. Friedman has his light on. Thank you, Chief. Thank you, Ms. Caliente.
Your resolution is effective immediately. I'm sure Mr. Casey is going to want to make some effort to get that communicated to the community before we enforce it. And next week, the ordinance will be an emergency ordinance, not necessarily an urgency ordinance, but an emergency ordinance.
Understood.
It will be effective immediately if the council so votes, and will involve some reading for Ms. Gorman.
Okay, she's ready. Mr. Friedman, some closing comments?
So for those who are still watching at home, I just, one thing my family that we discussed, and I think it's important to plan, is should you at some point come in contact with someone or need to self-quarantine in your home, is to have a plan so that you're not reacting once it's there. The importance of that is that you can make preparations, and we call it like the buddy system, is have a neighbor or a friend who you can rely on that should you have to self-quarantine can go to the store and get you groceries. They don't have to come in your house. They can drop them off on the porch. But we're all responsible for each other during this time. And to the extent that we could each have someone who can help us if we are under the 10 or 14-day quarantine within our homes. And if you plan now, it won't be such a shock as if you get sick and then all of a sudden you have to plan for it. So that's a critical aspect. And then I do want to give us one quote.
Please.
And it actually came from Dr. Jason Pruskowski. Sorry if I butchered your name, but he is at Cottage. He has been providing a lot of great information on social media, on a lot of his websites, and just he's been really a resource for many, many in our community. And today he had sent out a post earlier this morning with a lot of resources. But at the end, he gave the following quote from J.R.R. Tolkien of the Fellowship of the Rings. And it says, "I wish it need not have happened in my lifetime," said Frodo. "So do I," said Gandalf. "And so do all who live to see such times. But that is not for them to decide. All we have to decide is what to do with the time that is given us." And I think that's very appropriate for all of us right now. So thank you for everyone, for all you're doing. My colleagues up here especially, we're making a lot of tough decisions, and I appreciate all that you are doing.
Thank you, Mr. Friedman. Mr. Gutierrez?
Thank you, Madam Mayor. Thank you for everyone who is here and witnessing at home. One thing I just want to say is that there's a large percentage of the residents who feel like we're not doing enough to notify them, especially on Nextdoor. So I would just like to encourage all of you up here to be more active on that site in particular, because that's where I'm seeing most of the commenting on that. Other than that, I'd just like to give a little dedication to Alan Frank Snow. He's a 98-year-old World War II vet who passed away, and he was tough as nails, and he part of the Greatest Generation, and the grandfather of one of my good friends, and yeah, he was just nice to all of us growing up in high school, and allowed us to hang out at his house and in his pool and his hot tub, and he used to tease us about how much cooler of a parties he used to throw than us. And also to Bob Forsyth. He was a sailor on the USS Independence during the Cuban Missile Crisis, and he also passed away, and is the father of two of my good friends who grew up to be very patriotic just like him. And yeah, they're going to be missed. Thanks.
We'll adjourn in their honor, but we still have to do our consent calendar and then our public comment. So we'll take them. Let's go ahead and do the consent calendar. Would you read the items that we need to read?
Certainly. Item 1, adoption of ordinance amending the municipal code to simplify and streamline application of the living wage ordinance. Recommendation the council adopt by reading of title only an ordinance of the council of the city of Santa Barbara amending Title 9, Chapter 9.128 of the municipal code by the amendment of sections 9.128.010 and 9.128.020 relating to payment of mandatory minimum wage by city service contractors. Item 2, adoption of ordinance for lease agreement with Skate One Corporation. Recommendation that council adopt by reading of title only an ordinance of the Council of the City of Santa Barbara approving and authorizing airport director to execute a lease agreement with Skate One Corporation, a California S Corporation, for approximately 4,600 square feet of building space and adjacent parking lot space at 6100 Hollister Avenue, Building 5 at Santa Barbara Airport for a term of 5 years with 2 5-year options to extend. Item 3, updates to position salary control resolution for certain supervisor classifications to correct compaction. Recommendation that council adopt by reading of title only a resolution of the Council of the City of Santa Barbara amending Resolution 19-041, the position and salary control resolution for fiscal year 2020, affecting the salary range for certain supervisor positions effective February 15th, 2020. And that's it.
Very good. If there's no further objection, we'll waive further reading. Ms. Sneddon, an item you want to pull?
May I ask a question about an item?
Sure.
Or do I need to pull it first, or can I just ask?
Has she read the item?
Item 15.
Can you read 15, please?
Yes, item 15 is recruitment for city advisory groups.
Go ahead, please.
Thank you, Madam Mayor. I'm just wondering with our timelines of public meetings, if any of these dates might need to be adjusted.
Mr. Casey.
Yeah, Madam Mayor and Mayor Pro Tem Sneddon, we talked about that. We felt at this point, let's go ahead and post this, and we can adjust as need be if it doesn't seem like the timing is appropriate.
Very good, thank you. Then I'll move the consent calendar.
Thank you. A second from Friedman. All in favor?
Aye.
Aye. Okay, that's unanimous, Ms. Clerk. Thanks. Ms. Lindbeck, you're going to get the final word since you waited. You get 3 minutes up here. Thank you.
Thank you. I just want to acknowledge every single one of you for the immense work that you're doing. And it seems that right now there is a call for health on just about every level, everywhere. That seems to be now the topic of our lives. And so as the representative of 5G Free Santa Barbara, I'm here to thank you for the 90-day pause that you have granted us. And just to give you quickly a list of cities that have all been working on ordinances for the health of their citizens. So I'm simply on that basis of health, I'm going to just list you the cities that are working. We have Marin County, San Anselmo, Ventura City Planning, Ojai, Malibu, Beverly Hills, Oak Park, San Clemente, Encinitas, Sonoma, South Lake Tahoe, Thousand Oaks, Simi Valley, Westlake Village, Marin County, and San Anselmo, and the list goes on to Newark, Calabasas, Burbank, Glendale, Cypress, Palo Alto, Marin County, Palos Verdes, Beverly Hills, Malibu, Westlake, San Clemente, Petaluma, Sebastopol, Mill Valley, Danville, Walnut City, Sonoma, Fairfax, Sulson, San Anselmo, and Santa Cruz. And now here in Santa Barbara. So we're all working together on a massive issue, every single one of us. And to work with you in collaboration and partnership is an honor. Thank you very much.
Right. Thank you for your comment. That closes Vox Populi. Any committee assignment reports? I know it's been a long day. Anything urgent? Otherwise, we will close in honor of Mr. Snow and Mr. Forsyth. Meeting adjourned.